if we're ready to go. Are we ready to go? We've got everybody here.
Oh, he is here.
Yep.
Thank you for the opportunity to present.
You have a blue light?
Yeah. We appreciate you allowing me to go this afternoon. I do have some very relevant information I'd like to share. Like JG and said this morning, you know, we don't like coming in the room and being the negative people. That's not our MO. You all know I typically have a smile on my face all the time. But today I'm going to do my best to stay positive, but I'm also here to be realistic. So appreciate the opportunity to be here today. I am Alex Orrell, here on behalf of the Kansas Bankers Association. We were organized in 1887, and whose membership includes 99% of the 220 banks and savings and loans headquartered in Kansas. Our membership also includes 19 out-of-state commercial banks operating in Kansas. And the banking industry alone employs almost 16,000 Kansans that provide financial services across the state. Our organizational mission statement is this: together we support our member banks and bankers with leadership, advocacy, education to benefit the communities and customers they serve. To benefit the communities and customers they serve. The reason why I repeat that is because it sounds very similar to your role here as policymakers. You can easily change the last sentence of the mission statement to say, to benefit the communities and constituents you serve. I applaud your service to this state, and during these trying times, it is unprecedented, and we are all in this together. We're going to have to get through it all together and to have all of our wins when we get through this too. Because unfortunately, I think we're going to be here for a little bit.
Just you already.
I was asked specifically to talk about the pandemic and associated shutdowns and restrictions out of business that are financially serving the banking industry. Since as the banking industry, we do finance 99% of the business industry here in Kansas. I'm going to try to paint a picture today and talk about the different sectors as we go. But you do know I am not an economist. I do have a great staff who are here today that have helped me today too. We do have a significant amount of resources that we have at our disposal that we can share with you today. So I hope it's beneficial. I'll start with the ag sector. And some of these things you may have heard in my testimony, or the KBA testimony back in May. So I'm sorry that I repeat them if you've heard them, but I do still think they ring true today. Kansas currently ranks 6th nationally in new Chapter 12 farm bankruptcies, with filings increasing nationally 23% from the previous year to year. This marks the 5th consecutive year. So bottom line, the ag cycle has been in a down cycle for 6 years. Extremely concerning pre-COVID. Now we are into COVID and it's being exacerbated. When I'm communicating with our bankers statewide, specifically our ag bankers, they truly believe that 15 to 40% of their ag producers won't be cash flowing by the end of the year. I was actually even corrected back in May by some of my ag lobby friends that said, Alex, some of them are cash flowing at the beginning of the year. The continued low commodity prices has really taken a hit on our ag community, and this pandemic is not helping whatsoever. There have been some good things that have happened. The Paycheck Protection Program has served its purpose in providing short-term financial aid to many small businesses, and in Kansas, $5 billion alone was allocated and deployed to 53,000 businesses and helped preserve more than 500,000 jobs. That was a good thing. It helped keep our banks well capitalized. It also helped keep our businesses well capitalized to the best that they could. Helped them prevent them from dipping into their reserves. Some absolutely have, I'm not saying it hasn't. But it has helped banks as well not have to dip into their low multiple reserves, which has been a good thing for our sector moving forward, because we are in a position to have that capital. So bottom line, we are well capitalized, capital is available between these businesses. That's not the problem. It's cash flows. If you don't have the cash flow to meet that service, it's really hard to keep moving forward. And when there are restrictions in place, and I'm not a health professional, and I'm not going to criticize the restrictions and percentage of capacity, because that's not my wheelhouse. But we have a business that can only operate at 25% capacity. How do you expect them to continually cash flow? It is concerning. So paycheck protection was a good thing, without a doubt. But it also had some problems. It had two problems in my mind. It wasn't conducive to many ag producers. And you'll see later in my presentation where the ag sector fell and the amount of PPP loans allocated. They were down towards the bottom, you'll see in my presentation there. You'll also notice that the restaurant hospitality industry was able to take advantage of it too. But as you heard in May, when I was testifying this in the Restaurant Hospitality Association was testifying too, there were some gaps in there. When you don't have the employees to meet the employee requirements because you're shut down, you can't utilize those funds to get the forgivable loan. So there was some problems that happened that we're going to need to continue to look at and monitor because they are real. They are, if you talk to bankers across the state, business industry, the restaurant hospitality industry is truly struggling. That has been hit the worst. Speaking of the restaurant hospitality industry, Kansas City Federal Reserve President Esther George, who's a Midwestern gal, knows the ag economy, knows our communities that we serve and work with. But she said that this sector may take up to 3 to 5 years to fully recover. It's very concerning. And this ties into consumer behavior, and I'm going to mention consumer behavior a lot today, because as this pandemic persists, behaviors will continually change. If you could have asked me back in January, we had to-go cocktails, and something that would be something that could possibly stay on the books here in Kansas moving forward, I'll tell you, wow, that's a bold statement. But the fact is, consumer behavior has driven that, and the people have spoken on that too, and been vocal that this is something that's helped that industry stay alive. Another concern during the restrictions and shutdowns is downtown storefronts that were designed as non-essential were shuttered while their larger competitors were continuing to operate as they offered services deemed essential. We picked winners and losers. We try not to do that, but this pandemic has done that, and we have done that here too, where you can go into a large store, and I'm not trying to pick a fight between the big and the small retailers, but they offer the same service, yet one was able to say, that's going to have long-term ramifications because it was truly the small businesses that were impacted the worst. Commercial real estate values. I'm sitting here on Zoom where I'm talking to senators here on the phone and representatives of virtual has taken over our world. Frankly, I am tired of Zoom meetings. I like getting in front of everyone and talking, but it has changed our way of life and how we do business professionally and personally. This is going to completely change the commercial real estate market. It's already volatile, but as people start to transition and start to figure out that, well, maybe working from home is better for me than going into the office. I mean, my business will operate better in my home. What does that do to the commercial real estate buildings in the office space that has been leased? That's going to be a major problem moving forward, and something our bankers are looking at. The other thing that was mentioned earlier today that hasn't been talked about that much on this pandemic is the impact on our aviation industry, the air capital of the world, which talks. But we're not talking much about what we can do to help them. They are reeling too. Finally, I think I saw yesterday the 4 major American Airlines had a little uptick in their stock price. But travel has not picked up. It has not had that V-shaped rebound, and it won't. As health precautions and people worried about being quarantined when they return, or they're not able to travel through their work, those are going to continue to last longer this pandemic is around. You're kind of getting the theme of it. The longer this persists, the more it will compound into larger problems. The tourism industry and local convention and visitor bureaus are doing everything they can to survive. I can speak from the Kansas Bankers Association perspective. I don't just do government relations. We also do meeting planning and training for our members across the state. We've held over 300 meetings, conferences, webinars, seminars across the state every year, with close to 5,000 plus attendees at these in-person events. We have gone completely virtual the rest of the year. What does that do to, the Hilton Garden in Manhattan, or, the Brewery in Wichita, where some of our conferences are planned this fall? Those hotel contracts, thankfully, they are working with us, because once again, we're all in this together. But they are really hurting on that front, and it's going to be a major concern moving forward. Thanks also college sports. We heard yesterday Big Ten football and other major football conferences are canceling. Big 12 did today. But imagine what that would do to Manhattan, Kansas, if Big Ten football wasn't around. Major impact there. There's a quote that's actually 3 months ago today by Federal Reserve Board Chairman Jay Powell. He goes, "There is a sense, a growing sense, I think, that the recovery may come more slowly than we would like. A prolonged recession and weak recovery could also discourage business investment. The result could be an extended period of low productivity and growth and stagnant income." We're 4 months into this, with many more to go, and possibly even years in the housing industry. I mentioned the Federal Reserve Bank because this committee needs to look at the Fed as a resource. We do every single day. Part of most of my attachments I have in my testimony are 2 attachments from the Federal Reserve. They are an amazing resource. I would encourage people either listening to this call or listening to this meeting or on this committee to go to the kansascityfed.org and get on there and sign up for their alerts and their newsletters. They are very active, and you can get information on manufacturing, energy, housing, and so much more. There's no doubt that the uncertainty caused by the pandemic has changed behaviors. It's going to continue to. But bottom line, we are here to let this committee know that the banking industry is here, ready, willing, and able to serve the citizens of Kansas in any way we can. I'll testify a little bit more tomorrow on the banking industry specifically, what they have done through this pandemic, so I won't get into that today. But bottom line, capital is not the problem. There is capital available for businesses. It comes down to cash flow. My first attachment, and for the sake of time, I'll just highlight it, but it's the Kansas City Fed economic conditions from July. They have 3 main themes. Number 1, multiple indicators suggest that economic activity bottomed out in April, with more recent measures showing a pickup in activity on Zoom. Number 2, however, that activity has not fully rebounded and likely will not for quite some time. And number 3, Fed fiscal policy actions appear to have helped reduce financial stress, but the measures of stress remain elevated. A few other slides that they have in the presentation talk about first, GDP is declining at an unprecedented rate, and Fed Chair Powell even stated that the second quarter contraction is likely to be the largest on record. Job losses continue, but a slower pace compared to March and April. Consumer spending has increased, which is good, but it still remains below pre-pandemic levels. Business activity has increased, specifically here in the Midwest, but we are still down 10% of the hours worked in March and 15% of the businesses that were open in March. Now, these are this is the Fed District 10. There's 12 Fed districts. Fed District 10 that we are in encompasses Colorado, Kansas, Nebraska, Oklahoma, Wyoming, Western Missouri, and northern New Mexico. Transportation activity remains down. Oil remains under pressure. The 3 main things we're looking forward. Some areas have paused reopening plans after recent spikes, but as a result, economic recovery is uncertain and likely to be choppy. It is too early to tell, how much additional take-up there might be in emergency levy programs. There's still so much unknown out there. My second attachment, and I talked about the ag community earlier, and I spoke to communities in March and May about our concerns with the ag sector. I will point you to the ag finance data book. I know you're going to hear from some ag lobbyists tomorrow that can talk about this in way more detail than I can, because that is what it's all about. But I would encourage you to look at it. But the conclusion of that is there's a weak outlook for the agricultural sector with low commodity prices in the second quarter, which likely also weighed on lending activity. Delinquency rates on farm loans trended higher at a steady pace, and there have been signs of further liquidity stress. When you talk to bankers across the state, it's the ag community and commercial real estate values that really give them the biggest heartburn moving forward. The third attachment I provided in my packet is the Paycheck Protection Program report from August 8th. This is the most recent report. Paycheck Protection Program closed down on August 8th, but I'll go over a couple of the highlights here. It ended on August 8th with over $5.2 million, or 5.2 million loans across this country, totaling more than $525 billion, with over 5,460 lenders participating. A lot of activity. In Kansas, banks provided roughly 93% of those PPP loans across the state. Extremely proud of our bankers on the efforts they put forth because of the access to credit that Kansas has. There was a report, I believe by Bloomberg, that showed the amount of eligible payroll that was covered because of PPP. Just after round one, Kansas ranked third in the country with the amount of eligible payroll, and we were able to cover just in round one 78.6% of the eligible payroll for those businesses that were suffering from COVID. That's because of access to credit across the state, where people have relationships with those local lenders. The states that hurt the most, California and New York, were at the bottom. A lot more, not as many banks, not as much access to credit, and I think Kansas fared well because of that. There is a slide that also shows which industries received the most PPP money, with healthcare leading the way, of course, followed by professional services, construction, and manufacturing. When I talked about earlier about problems with the PPP, I think these 2 points definitely show where it occurred. Accommodations and food service ranked 5th, yet they're the ones that have been hurt the most. And ag ranked 17th on that list. PPP was not conducive for all, and they were only short-term solutions too. And I'll get into that in a second. But bottom line, proud of our Kansas bankers across the state that stepped up. In April, it was really tough when PPP was launched, I'll be honest. Bankers were working across on the weekend through the night, 24/7, trying to get those loans submitted to the SBA lead system. It was a nightmare for a couple of days. It was concerning. In conclusion, Madam Chair, there's a quote that one of my bankers actually submitted to me when I asked for some input regarding testimony. He's a chemical engineer before he became a banker, so this might explain why he thinks this way. From my perspective, the impact of the pandemic is much more like a mechanical wear from such event as a bearing failure. It starts somewhat slowly, but the effects compound as the problem persists. These programs that the federal government and state has done have been helpful, without a doubt. But the one thing that still remains that is a major concern to, I think, everybody who should be, is what are the long-term solutions? What happens when these dollars run out? What happens when the unemployment benefits run out? What happens after that? Right now, I talk about the banks being well capitalized and being able to provide that. But what happens when they need to start dipping into their reserves and those businesses need to start dipping into reserves. It's not that crazy of an assumption to think that capital will tighten a little bit forward into next year, and even into the middle of next year. There needs to be some long-term solutions, and I do believe there has been some opportunities missed on that front. I'm not going to speak ill of my county and unit of government friends. They do great work. That was the first thing that we did when we got our CARES Act money, is we sent that money to the struggling units of government that needed it. But there is a public and private partnership between those two. If those local units of government do not have economic activity, do not have jobs, do not have a strong tax base, they will always struggle. They will always struggle to meet their budget needs because they don't have the activity. So there's a partnership there that we really need to look at, and we work extremely well with them. They do a great job. But I think we need to keep that in mind as we continue to move forward with solutions. Another, I believe, missed opportunity was, frankly, a veto of a piece of legislation earlier this year. There was two specific long-term solutions that were in that piece of legislation that passed in an overwhelmingly bipartisan manner. Those are two long-term solutions that we could have used the last 3 months and moving forward, and we're not able to do that. We wish we had those tools to help those folks as this pandemic continues to linger. We need to look at the business sector a little bit more. I would urge the SPARK Task Force with their round 3. I think they have roughly $300 million left. I believe I heard from the Department of Commerce that we allocated $32.5 million for economic development in the grant process that will go last Thursday. Secretary Fullen himself, in his recommendations to that committee, initially requested $350 million for economic development. I think they need to look at that very, very strongly on what they can do. I've even seen members of the executive task force or executive committee and members of that committee saying we might be leaving economic development behind, and we need to look at this. So I would hope they would continue to reach out to us, reach out to business and industry, because you need that public and private partnership. You need that strong tax base, and you need to keep those businesses here struggling. I applaud the efforts of the Department of Commerce. They've done a fantastic job on recruitment of new businesses. 2 major announcements in the last week that are going to benefit for many years. But I think the priority really needs to be the businesses that are here. The ones that have paid taxes, made the sacrifices for years, injected their capital in the business, their livelihood. Those are the ones I think we need to look at first. Keep going after those recruitment, that's great. And that is going to provide jobs and economic activity for years to come. But we can't forget the ones that are here. Madam Chair, I appreciate the opportunity to be before you today. I wish this committee the absolute best as you move forward with your deliberations, your testimony, as you decide to help, provide recommendations to help move our state forward. I wish you the best. And with that, Madam Chair, I'd be willing to stand for questions at the appropriate time.
We'll go ahead and do that. I believe our next conferee is not available yet, so yes, I'll open it up for questions. No, excuse me. Oh. Okay, I will take just 2 questions. I guess our conferee is available. I misunderstood, so 2 quick questions, and you're coming back tomorrow. I saw who? Representative Kroll.
Thank you, Madam Chairman. Thank you, Alex. John, at the banking president did an excellent job in doing the PPP loans. Now we're starting the process of the forgiveness on those, and as you're well aware, those loans that are forgiven, they will get a 1099, and that will be income that they will have to pay income tax on. What effect is that going to have on those businesses that are struggling now, and then they spent this money, now they're going to have to pay part of it back in tax?
That's going to be, every business is going to be different, Representative, and I'm not going to have a concrete answer for you on that, even on that shop. Each business, depending on how they're able to recoup their cash flows, will be able to adapt to those situations as they come. It's gonna be each industry that has different, or each industry is going to have to handle that situation differently. And, you know, if they are taxable, and they are able to pay these taxes, then it should have a positive economic impact.
Thank you, Madam Chair.
Thank you. Representative Tarwater.
Thank you, Madam Chair. And thanks for being here. You did a great job, as always. You had mentioned in your testimony the veto of substitute for House Bill 2619 and the schools that were taken away from you. And you also mentioned that it was, I think, it was veto proof, right? Except for we weren't sessions of overriding veto.
Correct.
114 votes in the House, 29 in the Senate. Can you elaborate on that just a little bit, like the tools, what they would have done, and why you think that was vetoed? I mean, we got an explanation from the governor, but it didn't really make a lot of sense. Can you kind of comment on that?
Absolutely.
Thank you.
So there was two major tools within that piece of legislation that were long term. One, I'll start with the linked deposit loan program. Currently, right now, there's $60 million sitting in a pot with the treasurer's office with the pool money investment board. That money is being invested outside the state and getting a return of roughly 12 basis points. This is what I'm trying to argument against some of the message that veto message. The legislation would have guaranteed 25 basis points back to the state in the financial institutions. That $60 million is still sitting there. Linked deposit loan programs work. The Missouri legislature just this year increased their linked deposit loan program from $720 million to $800 million because it works. It's impact investing, taking the state taxpayer dollars and putting it back into the communities that paid it. Money goes around, and you know, as you put that money back in the community before it leaves that community, we learned this in our economics class, that dollar rolls over in that community 7 times before it leaves. Right now, some of those dollars are invested outside of the state and outside of this country as well. I'd say we bring some of that money home and invest it back here. The second part would allow banks to provide interest income on agricultural real estate and rural housing loans, which would have resulted, and this is an estimate from bankers across the state, about a 25 basis point, 0.25% reduction in the long-term real estate note. When you talk about the economic benefit there with these farmers and ranchers that are struggling now, a 0.25% reduction on that long-term note would be huge right now. And you could even make the point that that's needed more now than it was 2 months ago. So those are two that would, I mean, there was a cost to the state. There was a fiscal note associated with it. I believe it was $2.7 million. But our estimates on interest rate savings would have been $10 million. It wasn't just a dry cut. The economic benefit could be measured there, and it would have rolled over in those communities and help keep some of these farmers and ranchers from filing bankruptcy or not selling their farm, or being able to help out the local communities in any other way they do.
Thank you, Alex. And committee, I would suggest tomorrow, if you have more questions for him, he'll be back tomorrow. So just keep him till then. Our other conferee is waiting for us. So, Alex, thank you so much. Really, really good. Thank you. Okay, committee.
While we, I'm going to actually talk to Mike for this. While we have a break as they are getting queued up on the Zoom call, I did get a message from our staff downstairs. If you happen to have your microphone on in front of you, do turn that off. They're getting a little bit of feedback noise, and I think it might be through one of these microphones. Just a note. And I believe that our staff downstairs should be pulling that CDP conference off on the Zoom call now.
Yes. Would you mind if Alex did? Yeah, okay. Alex is still here. Let's just bring him back up. And then Senator Sloan-Trup, you had a question too?
Thank you. I just wanted to bring to your attention the slide, the interest rate amounts that agriculture pays over other. That's an issue, that we don't pay the same interest rates on loans. But also, you gave this excellent slide on inflation and where we're likely to be. I'm not an economist, but deflation has been on my radar.
Mm-hmm.
And it looks like we're in a scenario where we're facing critical agriculture at the 80s. We're facing the loan at real estate issues of 2007 and 8. And if we look, we had deflation during that period. It looks like, and with inflation under control, it looks like we're setting up for a similar scenario. That really worries me because deflation can send us into an inflationary spiral. So I would like your response, or if you need to look into that, what your thoughts are on it.
A few comments. The slides I did provide on the economic outlook was produced by the Federal Reserve Bank of Kansas City. I do not know those slides, but they are publicly available on the website for you to look. Regarding the 80s, I'll speak a little bit to that. A lot of our bankers are concerned that, yes, it's history repeating itself. We lost a lot of banks too. I think we lost roughly 50 bank charters in the 80s. That is a concern. But in regards to the specific, I do know, land prices have remained steady. There is one slide in there that shows there was about a 1% reduction. So they are holding firm with land prices to my understanding. They hold firm will be okay. But if they do go, that will be concerning. But I'll look more into that question this afternoon. Senator, I can get back to you in more detail.
Okay, and it's not just agriculture that is impacted, it's real estate, industry more than just agriculture. So thank you, Madam Chair. Thank you.
Senator Sloan-Trup.
First comment, part question. Looking at the Spark Task Force, the executive committee and the steering committee, there's one person representing a large financial institution, but I don't know if anybody greater has the ability to understand our Main Street businesses and the economic conditions across the state than our banking industry, our community lenders, investing in their towns and businesses. And did they reach out to you? Did they extend an invitation to anybody to be on the board or even on the additional persons on the steering committee to discuss some of these issues and provide some insight and help?
The simple answer to that, Senator, is no. I did reach out to the administration and said I would be absolutely willing to help in any way possible and throw some recommendations, your name of a commercial banker. There is a representative from a large institution, Capital Federal Savings here in town. And Natalie Hague is a wonderful person, really good attorney. She's an attorney, not a frontline banker, lender that's dealing with this on a daily basis. We wish the Spark Task Force would bring someone like that to the table to have these discussions, because you're exactly right. I mean, we finance 99% of the business industry in the state and did 93% of PPP loans in the state. Nobody's going to know what's going on with those businesses in different sectors than a community banker that's dealing with them. They still have round three. I don't think the group is exclusive. I think you could probably add to it. And if I were to make a recommendation, I'd make the recommendation that they would add a banker to that committee to help facilitate conversations and to discuss recommendations.
Thank you, Madam Chair. That will certainly be one of my recommendations.
Thank you.
Thank you very much.
Okay, do we have her up?
They were up just a moment ago, so I think it's ready, though.
You're unmuted.
She's switching back right now.
Okay. Thank you, Alex.
Thanks, Andrew.
There we go. Okay, now we're live.
You unmuted. Sorry.
Ready? Okay. Hi, my name is Farah Ahmed. I'm with the Kansas Department of Health and Environment. Can you hear me okay?
Yes, we can, thank you.
Okay,
Thank you for
great.
joining us.
Yeah, no, thank you for having me. So, good afternoon, everyone. Like I said, my name is Farah Ahmed. I'm the Environmental Health Officer and the State Epidemiologist with the Kansas Department of Health and Environment. Just because I haven't spoken in front of this committee before, just in a brief introduction, I have a Master of Public Health and a doctorate in epidemiology. And this upcoming November, I will have been with KDHE for 10 years. So next slide. So per Kansas Statute 65-118, all of these groups of professionals are responsible for reporting infectious or contagious diseases to public health. So it all starts with reporting from these frontline healthcare workers and these healthcare entities. So, you know, you've got your physicians and your nurses and your social workers, your long-term care facility administrators, the hospital administrators, all of these folks are responsible for reporting when there are suspect cases of any of the reportable infectious diseases to public health. So the case or outbreak data that's being collected and shared, it's being shared among the different levels of public health. First and foremost, our job is to isolate cases and quarantine those susceptible contacts. The point being to contain the spread of disease. And then secondly, what we're trying to do is we're trying to identify and monitor any trends so that we know what is normal or what is baseline in disease occurrence. Next slide. So this is just a snapshot of our current reportable disease list. So this was last updated in May of 2018. So I know it's not super visible here, but you can find it by following that first link on the slide. And then that second link will take you to the regulations that cover disease reporting in Kansas. So the specifics about what diseases are reportable, who has to report, what information is specifically reportable, all of that is outlined in KAR 28-1-1 through 18. Next slide. So I'm not going to go into a ton of detail here, but our reportable diseases are broken down by those that are reportable within 24 hours to public health and those that are reportable within 4 hours to public health. So this here is the list of the 4-hour reportables. So on this list, you'll notice that we've got outbreaks and epidemics and novel diseases are all covered under the mandatory to report. So COVID-19 obviously fits into this because it's novel, it's a pandemic. So every suspect case does have to be reported to KDHE. And then every outbreak as well has to be reported to KDHE. So you'll notice that normally our 4-hour reportable diseases actually require the mandatory reporter to call us within 4 hours. But in this case, just because of the sheer volume, we've requested that reportables go through either our online portal or via fax. Next slide. So a little bit here about how public health gets notified about cases of any reportable disease and how cases are investigated. So a mandatory reporter, those folks that we talked about earlier, they complete a notifiable disease form and they send that in either to the local health department or to KDHE. And that lets public health know that someone is suspected of having the disease, one of those diseases that is actually reportable. So then we've got laboratories that submit lab results directly to KDHE. So that lab report is going to come into our disease surveillance system, which we call EpiTrax, and it gets attached to a patient record. So if a patient has 2, 3, 5 labs, all of those lab reports will get attached to that patient record. So then KDHE, through our EpiTrax system, is sharing the patient record with the county health department for where the patient lives. So that's who has jurisdiction. So then the local health department is going to go through the investigation. So the questions in the investigation, when you're investigating a case, it's going to be a little bit different depending on what disease you're investigating. But the gist of it is you're trying to figure out where the case actually got the disease and who would have come into contact with them while they were infectious. So cases are isolated for a certain amount of time while they are infectious, and then their close susceptible contacts that are susceptible to actually getting the disease are then put into quarantine for their incubation period. And their incubation period is the amount of time that we think it takes for the disease to actually develop. So when we're talking about something like measles, for example, the number of close contacts that are actually susceptible to getting measles is actually probably not going to be that much, because the vast majority of people are either immunized or they're old enough to have actually had the disease, right? So they've built immunity. When you're talking about something like COVID-19, there's no immunization and most people haven't had the disease. So there's going to be a lot more close contacts that are actually susceptible to getting the disease whenever there's an exposure to a case. Next slide. So I'm not going to spend a whole ton of time here, but there is a really brief description of what the KDHE epidemiologists do. So that's the group that I oversee here at KDHE. So we're monitoring cases, we're looking for patterns and outbreaks. We're analyzing all of that case data that's coming in and we're publishing it online. Those are all the statistics that we publish on the COVID dashboard. We're creating guidance documents to guide local health departments through how to actually do case investigations. We're coordinating testing through the state lab. So we're working with different types of facilities like long-term care facilities to help arrange testing through the state lab. And then we answer phones 24/7, 365. There's always at least one epidemiologist during normal times. And during COVID times, I think we rotate on 4 epis on call at all times. And that's so that we can answer questions from local health departments and providers, whatever assistance they need. So next slide. So I'll get into a little bit of an overview for COVID in Kansas. So as of August 10th, Kansas had 31,730 unique cases. So these are unique individuals that had COVID-19, and that's in 103 counties. So that actually just leaves Rollins and Wallace counties that hadn't had cases. We've had 387 deaths and 1,911 hospitalizations. So as I mentioned before, KDHE epidemiologists are helping to oversee clusters of cases as well, where providing assistance to the local health departments. And a cluster is actually defined as 2 or more cases that have the same exposure. So 2 or more cases that were exposed at the same meeting or exposed at the same wedding or exposed at the same business. That's considered a cluster. So as of August 10th, we have had 397 total clusters across the state. Of those, we have 119 that are currently open and actively being investigated by the local health departments and or KDHE. So clusters make up about 26% of all of our cases. They make up about 30% of all of our hospitalizations and about 67% of all of our deaths related to COVID. So that means that the rest of those cases and hospitalizations and deaths have not been associated with a cluster. Next slide. So we break down our clusters into different categories. So you can see, for example, that private businesses have the most number of clusters associated with them, followed by long-term care facilities. You can also see that although meatpacking plants, for example, don't make up a lot in the way of numbers of actual clusters, they do account for a disproportionately high number of cases. So next slide. So looking at our counties that have the most total clusters, most of the counties in the state have dealt with less than 3 clusters each. Wyandotte and Johnson counties have dealt with over 50 clusters each, followed by other high population counties like Shawnee and Sedgwick, which would be expected. But you can see that some of our Southwest counties that are not necessarily high population counties have also had to deal with a lot of clusters, namely Ford and Finney counties. Next slide. So this map is similar to the previous, except that now I'm showing counties with active clusters that are being investigated right now. So you can see that Wyandotte, Johnson, and Shawnee counties have the most current and active clusters, followed by several other counties. Next slide. So in addition to providing local health departments with support with managing cluster investigations, KDHE is also helping to control the spread of disease by monitoring the testing capacity across the state and constantly researching new testing platforms that can be brought on by the state lab. We've created an interactive map that's available online where individual citizens can go and figure out where their closest testing locations are. And then we have another map available online where facilities can go to figure out where the different reference labs are that can analyze SARS-CoV samples. Meaning, you know, a hospital might be set up with the reference lab that they're using, but say, for example, turnaround times start to really slow down and they want to look into other reference labs. This interactive map allows them to just go and kind of find what other labs are available. Next slide. So I thought I'd mention here a little bit about contact tracing since everyone has heard so much about it. So contact tracing, along with, you know, appropriately putting people into isolation and quarantine, these are some of the most basic and strongest tools that public health has to control the spread of disease and to help control the number and impact of those clusters that we just talked about. So it all kind of starts off with someone who's identified as a case. So that means they've gotten a lab report that says that they have the presence of the SARS-CoV-2 virus. So that's what causes the COVID-19 disease. So public health then talks to that case. We're having a conversation with that case to try to figure out who they've come into close contact with while they were infectious. So if the case can recall everyone that they came into close contact with, and they can give public health names and phone numbers on how to get a hold of their close contacts, then public health is going to move on and start talking to those close contacts and notifying them that they've been exposed. So it's really important to note here that HIPAA and state privacy laws protect the identity of the case. And so contacts aren't being told who they were exposed to. It's just that they were potentially exposed to someone on a certain date, and now they have to begin a quarantine period. So if the case can't recall who they came into contact with, then public health needs to probably work with a third party. So if, for example, a positive worker works on an assembly line, he might be able to tell you the day that he worked, the shift that he worked while he was infectious. But maybe he can't tell you everyone who worked on the line. -118, Section C, which does allow for information about a case to be disclosed in certain conditions. One of those conditions is you have to have consent from the case to disclose their information. But one of the other criteria is information can be disclosed if necessary and only to the extent that's necessary to protect public health. So prior to House Bill 2016, that list of close contacts that the employer is putting together, that would have automatically been shared back with public health. With the new regulations, the employer actually has to get consent from the close contacts to share information back with public health. And close contacts can opt out and say, no, you can't share your information, my information with public health. So whatever the path is, once public health knows who those close contacts are, either KDHE or the local health department is calling them to let them know that they've potentially been exposed and now they're in a quarantine period. So per the new regulations, public health is also going to ask those close contacts if it's okay for them to be contacted every few days by public health, because public health is going to check on their symptoms, check to make sure they're doing okay. If they do develop symptoms, then public health is going to help arrange for testing. In some counties, local health departments also have care coordinators that can help arrange for, say you're in isolation or quarantine, but you need help getting groceries or you need help getting your medication. The care coordinators can help with that. So per the new regulations, we are going to ask those close contacts, are you okay with public health contacting you every few days to check up on you? And they can say no. So no, please don't contact me, don't call me, don't email me, and that's fine. They can opt out of that. They can't opt out of actually being in quarantine. So they still get the information about their quarantine period, when they're released from quarantine, what signs and symptoms to look for. We just won't keep calling them or texting them. Next page. So this graph here depicts our cases for the state by symptom onset date. So that means the day that the cases reported that they first started experiencing symptoms. So for cases that are asymptomatic, meaning they don't experience any symptoms, we actually use the date that their sample is collected. So if you look at the blue lines, you can see two distinct curves. So that first curve shows our peak of cases around the end of April. And then you can see a dip and then a second curve that started around the beginning of June. So there's a few points to note here in the timeline. So March 16th, that was the day that schools were shut down for the rest of the school year. March 30th was when the governor issued the stay-at-home order. March 4th is when we go into phase 1 of the Ad Astra plan. And just as a reminder, the phase 1 meant no mass gatherings greater than 10 people. There were a number of different activities that weren't allowed to open. So community centers, large entertainment venues, fairs, festivals, parades, graduations, public swimming pools, organized sports and camps and all of that, that was not allowed to be open. There were also a number of establishments at that time that weren't allowed to be open, so bars and nightclubs, non-tribal casinos, gyms, and fitness centers, and personal service businesses. What was allowed to be open were childcare facilities and libraries. Then May 18th, we move on to phase 1.5, which looks very similar. You know, mass gathering numbers are still to be kept less than 10 people. A lot of the same activities are not going to be allowed. A lot of same establishments are still closed. The activities that do open up still, we've got childcare facilities and libraries, they're still open. We're allowing commencement ceremonies and personal service businesses to open, and fitness centers and gyms. And then on May 27th, the Ad Astra plan becomes guidance. And so at that point, counties choose where to place themselves in the phasing and what to open and when to open. And I'll just note here that the passage of House Bill 2016 is just included on this timeline as a reference point. We're definitely not implying that it had anything to do with the increasing numbers afterwards. That wouldn't make sense. So let's go to the next slide. So let's go back to March. So we're seeing our first case reported to us on March 9th. So in March, we have a total of 428 cases and 9 deaths. And at that point, we've got 39 counties being affected. Next slide. So then in April, we're up to 4,238 total cases in 80 counties and 129 total deaths. So we've got 120 new deaths from the previous month. Next slide. So this map shows what the state looked like for cases per 1,000 people around mid-April. So you can see that most of our counties, we're seeing some cases. By sheer numbers, Johnson, Leavenworth, and Sedgwick counties had the highest number of cases. And then when you look at the rates though, which is the number of cases over the population of that county, then you see that Coffee County's rates were pretty high at this time. Next slide. So then this is what the state looks like 2 weeks later at the beginning of May. So now you can see we've got some hot spots emerging in the southwest part of the state, particularly in Ford, Finney, and Seward counties, which are big meatpacking counties. Next slide. So that takes us to May. And in May, we're up to 9,719 total cases in 88 counties being affected, and 208 total deaths. So that's, a little over 5,000 new cases in a month and 79 new deaths. Next slide. So by mid-May, the southwest part of the state is really emerging as having the most cases per population. So Lyon County also starts to emerge as having a problem. Of course, they're also a meatpacking county. So even though there may have been a lot of focus at this time on some of the more urban counties in our state, you can see that some of the other counties, particularly, Ford, Finney, down in the southwest area, they're really struggling. You can also see that something's happening up there with Leavenworth County as well, and that was tied to outbreaks at Lansing Correctional. Next slide. So then 2 weeks later, we're looking pretty similar. We've added a few more counties that are starting to see their first cases in the central west part of the state. Next slide. And then in June, we're up to 14,443 total cases in 97 counties being affected now, and we're at 270 total deaths. So a little under 5,000 new cases in a month and 62 new deaths in a month. Next slide. So from here, and so this is mid-June, and then go to the next slide. And this is the beginning of July. So we see more counties starting to have cases. But again, you know, that southwest part of our state remains the hot spot for most cases per population. Next slide. And now into June, July, we're now up to 27,812 total cases and 358 total deaths. So you now see that we've taken a jump to nearly 13,000 new cases in a month and 86 new deaths. Next slide. So mid-July looks pretty similar, with more counties starting to be shaded a little bit darker, which indicates an increase in their actual rates. And then next slide. So then finally, that takes us to the beginning of August. So you can now see that we've got 103 counties being affected. Our highest rates are in Wyandotte, Leavenworth, Ford, Clark, Finney, and Seward counties. And again, we're not seeing any cases yet in Wallace and Rawlins counties. Next slide. And then as of August 10th, we have 31,730 cases in 103 counties. That's 387 total deaths so far. So next slide. That's all I have. At this point, I am happy to take any questions.
Thank you. That was a lot of information. Committee, are there any questions? Representative Tomlin.
Thank you, Madam Chair. Thank you for your presentation. I had some questions regarding, or a question regarding the maps, the density map, I guess. The southwestern Kansas counties turned blue very early. They blew throughout. Have you done a breakdown in those counties as far as new cases? Because if it's based on number of cases per 1,000 individuals, once they turn that dark blue, they're going to stay that dark blue because there's only so many people. So is the disease more or less eradicated in those counties now, or are they still having plenty of new cases?
Right. And it might be a little difficult. Actually, I'm positive it's difficult to see on the slide. But if you do go to our dashboard, you can see that early on, you're correct. Those southwest counties had a lot of cases really quickly. That was really associated with outbreaks at the meatpacking facilities. They've remained high for not just number of cases, but also their rate of cases. And so what we saw over time is it started off in those meatpacking facilities and really bloomed out into the community, and then we started to see a lot more clusters in then long-term care facilities and other businesses. And a lot of it, you could see it blooming out just from workers that worked in those plants.
Okay, thank you.
Any other questions? Representative Williams.
Thank you, Madam Chair. Thank you so much for your report. Your awesome info here, and just wanted to get some, maybe a little bit more clarity if it's possible. We often hear about the number of cases, tragic cases that occur in our nursing home facilities. And at one point, I remember reading that in Johnson County, every death occurred at a nursing home. That's maybe been several weeks ago. Do we have some data to give us an idea of the number of our total deaths in Kansas? that are from nursing home facilities?
Yes, that's a really good question. We actually published that data on our COVID dashboard, which I can't pull up live, but what we do is we show all of our clusters. So either you can pull it down and look at total clusters, or you can look at the active clusters, or you can even look at the closed clusters. And then the data will change and it'll show you the number of cases that were associated, the number of hospitalizations, and the number of deaths. So you can see the number of deaths that are associated with long-term care facility outbreaks for all of them, closed ones, active ones, total. And that actually also leads to an interesting point. You might have noticed that when I was talking about the number of outbreak or cluster-related cases that were around 30% and hospitalizations that was similar, you might have noticed that we have a disproportionately high number of deaths associated with our clusters. And when you dig deeper into that, that is being driven a lot by the clusters in long-term care facilities. So deaths among the older population is what's driving that number.
Okay, I found that on your website. That's very helpful. And then another question, if I may, regarding asymptomatic versus symptomatic, on the KDHE website, it gives the symptomatic and asymptomatic, and then it has a very large number continuously that that's not reported. Are those individuals that just refuse to give information, or should we assume that those are asymptomatic?
That's a really good question. So we get symptom information a few different ways. So when a physician or any of those mandatory reporters are reporting to us that they have a suspect case, they might fill in symptom information on that reportable disease form. So we might get it that way. Or, we might figure out what the symptoms are when the local health departments are actually doing their case investigations. So they're talking to a case, and that's part of the investigation is, do you have symptoms? What was your first symptom? When did it start? So if the local health departments haven't been able to get that information because they haven't been able to reach cases to do a full investigation, or if they've done the investigation but it hasn't gone into the tracking system, into EpiTracks, then that data would be missing. So no, we can't assume that all of the missing data are asymptomatic people. They could just be investigations that haven't been completed.
Thank you, Madam Chairman.
Senator Solentrop, and then Representative Cole.
Thank you, Madam Chair. Good afternoon. Thanks for your testimony. I'd like to have you provide us of the deaths that are listed as occurred from COVID. How many had underlying symptoms? Categories of those symptoms? How many persons died only from COVID-19?
That's a really good question. We have been able to report on the number of deaths. We have been able to report on age breakdown, race, ethnicity breakdown of our deaths, but we have not been able to dig deeper and look at comorbidities. That's a really good point, and we could do that. It would work if it was listed on the death certificate, or if we had the manpower to go in and get all of those hospital records and dig through. And essentially what you're doing is you're abstracting medical records to find out what all the underlying conditions would have been. So it can be done. It would take some manpower. I'm making a note.
Good. I'm not demanding it tomorrow or requesting it tomorrow. I'm suggesting that we begin to gather that information and continue tracking it going forward. So over the next weeks and months, I'd like to have that work done so that we can get a better feel for, any causes of comorbidity or any of those cases where COVID-19 was strictly the cause of that. Thank you, Madam Chair.
Thank you. Representative Kroll.
Thank you, Madam Chair. Thank you for all the information, tremendous amount of information, and I have notes what I'm going to ask as I'm going through this. But right now, we have, I think, a total of 31,730 cases in Kansas. How many of those are active at this point in time?
How many are active cases?
Active cases? Oh, okay. I think what the question is how many active cases we have. Is that correct? Did I hear that correctly?
That's correct.
Okay, so this is actually a really interesting point, and we have been asked really from the beginning if we are able to report on quote unquote recovered cases. What that is trying to get at is exactly as you're asking, how many actual cases are currently infectious. We are not able to get at that number for a couple of reasons. One, some local health departments, when they're investigating their cases and following their cases, are noting down in the surveillance system when a case is released from isolation, but not all are. So we don't have really great numbers on that. The second reason is you can't apply like a blanket formula and say everyone is considered a closed case after 10 days or after 14 days or 20 days or whatever. The reason being, if you're a case, then your isolation period, the period that you're considered infectious, for most cases, it's going to be 10 days or 72 hours fever-free without the use of medication, with other symptoms improving, whichever is longer. So cases are isolated or considered infectious for a minimum of 10 days, but it's a case-by-case basis, which is why we can't just apply like a blanket formula and say, okay, after 10 days, all cases are considered recovered. So that's why it's a little bit complicated and we can't quite get at that number.
Thank you very much. Thank you, Madam Chair.
Senator Tyson. Senator Tyson.
Thank you, Madam Chair. I have several questions. One is, when you talked about, and thank you for your presentation, all your work you put together, you talked about the data that is reported and goes into the EPIC database, if I remember correct, EpiTrack database. What type of information are you collecting on individuals, and does it require the individual to be aware that they're in that database?
That's a really good question. So for all of the reportable diseases, when public health does an investigation to, again, we're trying to figure out where the case got the disease from, what their symptoms are, if they've been hospitalized, plus demographic information like, their age, well, we've got their date of birth, their race, ethnicity. That's the kind of information that's collected during a case investigation. And the way that it looks in EpiTracks is, so say there's a Johnson County case. That Johnson County case, only Johnson County Health Department can see that case. So they're going to pull up the case investigation form. They're going to do the interview and collect all of that information that I mentioned about the case. And then it's stored in the surveillance system. So it's a medical record, and it's held like a medical record and is subject to all the same privacies as a medical record.
Okay, that's what I was wondering. And are you using that database, EpiTrack, also for the contact tracing, or are you using another database for that?
That's a really good question. The final information about contacts is kept in EpiTracks. So the way that it looks is you've got a case, and then you've got the contacts that are associated with that case in EpiTracks. So right now, say you're doing your monitoring of a close contact for 14 days, you're checking on their symptoms, checking how they're feeling, have they gone anywhere while they were in quarantine. All of that information is also stored securely in EpiTracks.
Okay, I would also be concerned who has access to the EpiTracks database. We were told yesterday that Salesforce is also being used for contact tracing. Is that correct?
Correct. So what Salesforce does is it's a separate application. So before we had Salesforce, in order to do contact investigation and contact monitoring, you had to have access to EpiTracks. And so you had to be in our secure system. And what Salesforce has allowed us to do is have an application outside of EpiTracks so that we can have contracted people doing that contact monitoring and calling the contacts and checking on them, seeing how they're doing, putting that information into Salesforce, and then that goes into EpiTracks. And that contracted contact tracer is not in our surveillance system.
Okay, I have some concerns over that, especially merging the two systems, but I'll move on. What Senator Stoltenschrodt asked the desk, we've all heard the rumors and the accusations. We also have people in the medical industry that have told us that individuals did not die of COVID-19, but they are being counted as such case. So I think the data that he asked for is absolutely critical in order to get an accurate picture. And I would be remiss if I did not bring up, I have two other questions, if I may, Madam Chair. The contact tracing handout that you distributed said that business rules requiring them to contact trace as of August 1st, and that it's the law. What law is requiring that?
So let me address that first part first. Let me describe a little bit about how and this is actually a really good question. How do we count a COVID death? There's a few different ways. So if we get a report from a local health department, so a local health department is about to do a case investigation and they find out that case has actually died from next of kin or whoever, they're going to note that in the EpiTracks system. Or we have a lot of providers that call us and tell us, okay, this was my patient, he or she passed away. That gets marked in the surveillance system. That's step one. Step two is that we are actually looking at the death registration system. So these are, the medical folks who are actually certifying the deaths and putting it down on the death certificate that's the official cause of death. So we are looking in the death registration system. So if we have something in EpiTracks that says it was a COVID death, but the death certificate comes in and the person that certified the death didn't put anything about COVID down, our vital statistics folks are calling that provider up and saying, by the way, did you happen to know that there was a positive test result for this patient? Because a lot of times the certifier, they might have had to, certify the death before they had test results back, or there's other issues. So our vital statistics staff are letting the provider know, did you by any chance know that this was a positive COVID patient? If the provider says, nope, I didn't know, and that makes sense, and yes, I'll modify the death certificate, great, it goes on the death certificate. If the provider says, nope, I knew that, but I don't think any of the causes of death, I don't think that the reason that this person died had anything to do with COVID, and then that death certificate is the official record, so it gets taken out of the surveillance counts. So whatever is on the death certificate ends up being the final and true cause of death. And then I'd be kind of remiss if I didn't mention, even though we for our Kansas deaths, don't have good drilled down data on what the comorbidities are. There is good national data looking at the comorbidities, and a lot of it does have to do with diabetes, heart conditions, respiratory conditions, the things that you would expect, those chronic conditions influencing the mortality rates. And interestingly, among children actually becoming cases and passing away from COVID, obesity seems to be a driving underlying factor. Let's see, and your second question was, yes, the contact tracing. The law that it is referring to is House Bill 2016 required that KDHE promulgate regulations by August 1st to actually operationalize how how contact tracing would be done to meet the requirements of House Bill 2016. And so that's the law that they're referring to in this handout. And so the big four things in the law were, one, it established a minimum education requirement for contact tracers. Two, it established a training. So contact tracers have to receive KDHE approved training, of which we do have one publicly available, but there are also CDC trainings available. Three, that the contact tracer had to sign an oath saying that they took the training. Four, that close contacts were, when a third party is creating that list of close contacts, that list cannot be shared back with public health until there's consent from those close contacts. And then the fifth big thing was that close contacts had to be notified verbally that they could opt out of public health monitoring, which means don't call me for 14 days, don't text me for 14 days, they can opt out. Those were the big highlights of that law.
Madam Chair, if I may, I was gonna pull up the statute. There is nothing in there that puts the burden of the business as being required to do contact tracing.
Correct.
And I did not see any of it in the rules and regulations, which we just went over yesterday, that required businesses to do contact tracing.
Correct. You're correct.
Interpretation of the law, I guarantee there's going to be major pushback. Are you familiar with the situation that went on in Lynn County?
Lynn County situation.
Lynn County situation. Can you give me a little bit more detail?
Lynn County tried to require businesses to do contact tracing. Anybody that came in their business, they had to log. There was major pushback, and believe me, it stopped almost immediately.
Yeah, no, I completely agree that there is nothing in this law that requires businesses to do contact tracing or to help with contact tracing. Yeah, you're correct, but public health does have to get the job done somehow.
If an average person read your handout, they would think that it was a requirement on business. Their role in business statute changed. The implication is that they do have to keep track of it.
Okay, we will take a note of that.
Thank you, Madam Chair.
Thank you, Senator Tyson. Further questions? Representative?
Thank you, Madam Chair. If I may, just a couple of questions. Thanks for your presentation. If memory serves, you said you've been with the department about 10 years, is that correct?
Yes, sir.
Okay, so 2010 would be kind of the end of the H1N1?
I was lucky enough to come right after it finished.
You what?
I said I was lucky enough to get here right after it finished.
Okay, all right. Do you recall, I think, wasn't the number nationwide, wasn't it like 60 million H1N1 infections nationwide? Does that number sound right?
That sounds about right.
Okay, all right. So I guess, do you remember doing anything like this in Kansas, taking these measures that we've taken as far as contact tracing and stay-at-home orders, things like that for that H1N1?
So that's a really good question. Again, I wasn't here at that time. What's done as far as investigating cases, figuring out who close contacts are, putting them in quarantine, that's all very standard public health practice. It's not at all unique to COVID-19. That's how we investigate and control most diseases in the state.
Well, I wasn't involved in government at that time, just a private businessman. I just don't remember that we did that kind of thing 10 years ago. So I guess my last question was just asking for your professional opinion. As an epidemiologist, what do you think sets this coronavirus apart from some of the other things we've been through, like SARS and H1N1 and MERS and everything like that we have taken these kinds of actions?
That's actually a really good question. Every day we're learning, right? We're learning more about this virus every single day. It ended up being a lot more infectious than what everyone thought in the beginning. If it was going to act like a lot of other respiratory viruses, it would not have been as infectious, meaning if you've got a case, not that many close contacts would actually become sick. So that's a little bit different. It's a little bit, yeah, I think just the sheer number and the trajectory of people that have become infected has been so much more impactful on public health than anything else. And like I kind of talked about earlier, for a lot of diseases, we've got our public health measures to control, but there's also natural immunity from immunizations or from having the disease. And so you've got a huge population that is susceptible to getting the disease. The other thing, is we're seeing that, as somebody, very astutely mentioned, there's a lot of underlying conditions that are exacerbating the problem. It's not just people with asthma are going to have a worse time. It's respiratory diseases, cardiovascular diseases, diabetes. There's so many other chronic conditions that are so prevalent in our society that are exacerbating the situation. So I think it's a lot of different factors.
Madam Chairman, just one
Absolutely.
slide. That wasn't my last question. Much of your response there was retrospective. It's things that we know now in August. And yes, I would agree the numbers are staggering. But according to your timeline too, we issued the order to close schools on March 16th. And March 30th, the stay-at-home order. By that time, we've had very few cases, relatively speaking, and very few deaths, relatively speaking. So we really knew next to nothing about where this was going as far as the trajectory that you referred to. So I guess I'm looking for your opinion as an epidemiologist. What did they know back in March, health professionals worldwide and in the nation that would lead you to believe that these kinds of actions were going to be necessary?
It was, sorry, I'll stop interrupting you.
No, was there some information that we didn't have as general public that epidemiologists and health professionals worldwide knew that this was going to be such a nightmare?
Right. So, back at that time, again, every day we're learning more and more about, this is way more infectious than we thought. Something else we're learning at that time is with a lot of diseases, you're not considered infectious until you've got a fever. Well, now we're seeing all of these cases, nobody's mounting a fever, but they're able to spread the disease. And most diseases, you don't spread the disease if you don't have symptoms. But we're seeing more and more cases where asymptomatic, perfectly healthy people are testing positive and they're spreading it to other people. So all of that was new and new to COVID-19. And so it was a time of what is going on? We need to slow things down and get a grasp instead of us shooting to an exponential curve. What can we do to kind of slow that curve? We knew we were going to have more cases, but what could we do to slow that down?
Representative Clayton.
Thank you, Madam Chair. I think a lot of our conversation here, Doctor, or at least throughout the state, while we've all been in lockdown, kind of mulling down how this is all going to end, is we've heard a lot about herd immunity. But obviously, some of these epidemics that we've looked at in the past, there are some where you get it once, and as long as you get a tough enough case of it and you develop the antibodies, you're not going to get it again. But there are others, I'm sorry, I'm a history major, so going back to say like the sweating sickness in Tudor England, you have people getting multiple infections of this. I know that our information is changing day by day, but what can you tell us as of today regarding what we know about COVID-19 and reinfection? Because if this is something that reinfects, then this is a completely different ballgame, and I think it really alters the way that we continue to have these committee discussions, right? So tell us the latest that you know as far as the infection rate.
Yeah, really great question. So this is something really interesting. So if it was any other kind of coronavirus that causes, the common cold, a lot of other viruses, most of the time we would expect people to have immunity for about a year. Very early on, we're starting to get case reports of people looking very much like a reinfection, meaning they've got symptoms, they completely resolve, they're out of their isolation period, several weeks go by, and then symptoms start again. And they're new symptoms, not even symptoms that they had the first time around. So what we know right now and what the thinking is right now is that most people will have some kind of antibodies for about 3 months. And that's what the thinking is right now. Now, to complicate that, what we've also learned is that there are a lot of people who, for lack of a better term, it almost becomes like a latent illness. So their symptoms resolved, and then they're fine for a while, and then they get sick again, and it's new symptoms or it's worse. And so is that a reinfection, or is that simply a reemergence of the same first infection? And that's what's trying to be teased out right now. But as of right now, the thinking is that probably about 3 months of immunity is where we're at right now.
I really wish that wasn't the case. Thank you very much. Thank you, Madam Chair.
Thank you. Are there any other questions? We have another conferee. Oh, Senator Tyson.
Thank you, Madam Chair. After listening to the questions and the information, I would ask that you give us the data, a chart overlay with the flu and pneumonia and the COVID death cases. Would you mind?
Actually, that is a really good request, and I had already started to do that. I'd already started to pull data on H1N1 cases, hospitalizations, deaths versus 3 of our regular flu seasons versus COVID. So that's actually being put together, and we will provide that as soon as it's ready.
And if you would add pneumonia to that also, I know that the deaths are higher on it than flu, so I think that might give us a more accurate picture of what we're looking at.
Will do.
Thank you. Great questions, committee, and thank you so much, Doctor, for your presentation. And if there's a request to have you return at some point during the next 4 committee meetings, would you be willing to do that?
Yes, of course.
Great. Thank you so much. Appreciate it.
You're welcome.
Okay, committee, we are going to move on now to our last item, well, not our last, our second to the last item, and that is Dr. Russ McCullough, and he will be giving a presentation on the economy. I know we're kind of shifting around a little bit, but everybody has a schedule, and we take them when they're available. So welcome to the committee.
Thank you. Good to be here. Settled up here.
And committee, you know, there has been a lot of, obviously, in our districts, the talking about reopening the economy. And that's probably the number one thing that I hear. It's the schools, reopening the schools and reopening the economy, because everybody is very anxious to do that. So thank you for being here.
Yes, thank you, and it's a pleasure to be here to talk on this. I think what I have to present here with businesses is closely related to what we're considering with schools as well. And so I wanted to frame my talk. You saw, hopefully you've got a copy of the policy brief that we did. And I wanted to frame that discussion around economic freedom. I'm going to pretty much walk through the handout that you have. I might not be spot on, but that's my plan. So I think it's important to identify what does it mean for people to have economic freedom. And so that first definition, I won't read it verbatim, but the ability to have property, to get it without forced fraud or theft, and have that property protected. And you can use and exchange it, and you can do pretty much what you like, provided you don't violate the identical rights of others. Well, a lot of that, of course, related to COVID has changed. And so states are ranked with the Economic Freedom Index, as well as countries. And this was work that was pioneered by Jim Gordon, who was an undergraduate alumni out of university. And so how do you achieve a high economic rating? Keeping government spending and taxes low is one way, because that means more money in private hands, right? If you have more individual economic freedom, if your tax rates are lower, we're shifting more funds into private hands as opposed to public hands. Sound money, that's more of inflation, again, for the states doesn't matter as much. Protection of property rights. And I highlighted enforcing contracts even-handedly. I don't think that went on very well with some of the responses to COVID, in that we had mom and pop businesses on Main Street that sell about the same type of products that Walmart sells, and yet the big boxes were able to sell. So I think we broke the trust of some long-standing business foundational principles when we did that. So no trade barriers, of course, state to state, that's basically non-existent. And just in general, regulations that undermine voluntary exchange. And again, I think the regulations that we impose are not allowing two private individuals to come together in voluntary exchange. So that kind of helps frame the ideas that I'm going to put forth in terms of how policy is approached to work our way through this pandemic. So on the next page is some snippets from the policy brief. I had some bullet items there. 40% of businesses don't expect to return to pre-crisis levels at the end of this year. 60% of businesses are concerned about getting customers back, is what their greatest concern from the survey results. 76% of businesses are fearful or uncertain that there will be permanent closures. 76%. So the impending issues as the lockdown continued on were more and more pressing. This survey was in May, so remember this was kind of early on before we started to open up to some of these responses. You can keep that in mind as we work through. The goals of the survey were to identify customer safety, worker safety. You know, what were business perceptions on? Is this something you can do? Is it overwhelming? And the overwhelming response that we got was that we can keep our customers safe if we have customers. It kind of came back to a lot of that. And we can do what the guidelines are in terms of the things we've been doing now with disinfectants and cleaning, extra cleaning, and masks and so forth with our workers. So I think the responses that we got from our campus businesses was that they were willing to do those things to keep open and stay open. And so then the other parts of the survey were, what are the government response? What is the best way for them to handle things moving forward? And so I want to come back to, happy to, address questions when we get to the question time on the policy briefing itself. But that was the general takeaway, that I got from there. And I'm using some of the free responses in my presentation that some of the, Kansas business owners, said, as part of the survey in my presentation today as we go through. So, the 5 areas of the index, we kind of ran through in that paragraph. Size of government, legal system for property rights, the court system, police system, all of that stuff is all surveyed from external sources to give rankings to countries, and then also there's a state index. And so I have some good news. Kansas is ranked 10th, and I did another presentation on a subcommittee last January before all the COVID hit. And in general, Kansas has been doing pretty well over the years. Neighboring Missouri 16th, Iowa 28th, Kentucky 43. I just picked out a couple of them. Tennessee 3rd was on that United States map there. Why is that important? There's evidence that shows we get some nice outcomes with less poverty, higher incomes, countrywide, better access to drinking water, lower infant mortality rates, longer life expectancy. Of course, those are pretty even across the United States. But the income was kind of interesting. That last graph on page 4 of your handout, the bottom one. In 2004, the states that I just identified were pretty close in terms of economic freedom. Over the years, from 2004 through 2018 and close to today, Kansas made those strides, and we have more economic freedom according to this research. And that has paid off in terms of personal income. It's kind of hard to read on your handout there. There's a digital one that you can blow up that I believe was emailed out to you. Kansas is now at 51,500, and Missouri was at 47,700. So when incomes were very similar and freedom was similar, these changes that we made to promote freedom did end up paying off in terms of personal income. The next slide I wanted to bring up comes a little bit, I guess, to my training as an economist, and that is when this epidemic hit, there was so much uncertainty, right? We can think back to the way we were thinking in March and April, and given that type of uncertainty, mathematical models don't work very well. And we saw that unplay, right? We're going to have 2 million deaths or, 200,000 deaths here, the charts were doing this. But the problem was there was really too much uncertainty for those models to work very well. And due to that uncertainty, I think there was a reason to shut down. We don't want that number of deaths. Those number of deaths was a possibility. We just didn't have any clue, any way to really significantly mathematically model that, in my opinion. And so now, as we've gathered information over time, I think we're in a position to make much better decisions. We learned today some of that information from that was just presented before me. So I wanted to bring up their data and think about healthcare capacity as a policy tool. So from their website there at the ks.gov, they have really some nice information, and the ones I circled there for you was today the number of ICU beds available, 47%. So in terms of capacity, if cases spike and all of a sudden sickness spikes and we've got some capacity. To me, the most important thing is that we need to get Kansans proper health care. We don't need our healthcare workers working overtime and stressed hours. So our normal operating capacity needs to be there. And if people are going to get sick, we're going to get sick. To me, the status quo became, let's just assume we're likely going to get sick. Do I have healthcare professionals that are going to be able to help me in my time of need? Ventilators, 84% of the ventilators in Kansas are still available right now, right? So if we get to that critical care of need, which we very well might at different times, we're there. We have the means in terms of what these tools. And so when I say healthcare capacity as a policy tool, I would urge our leaders in policy to set clear benchmarks, something that's pretty easy to measure. And that capacity, I think, is pretty easy to measure. And so I don't know what the X percent is, but it's, ICU beds, if there's only 10% available, 15% available, 3% available, that's for healthcare professionals to figure out. Whatever that X factor is, I think that is the policy tool that would help get good information out to our public so business people and individuals alike could start to make decisions about school, about other things. If we're far from that benchmark, we shouldn't have parents wondering if school is going to indeed start. If businesses even as early today, I heard people saying, well, I don't know if another shutdown is going to happen or lockdown. All that uncertainty is awful. And if we have that kind of capacity, I think we have the power to change that, to create more certainty through having a clear benchmark, such as healthcare capacity. And maybe healthcare professionals and other people can come up with a lot of other ideas. But to me, that is one that jumped out at me, and it's a variable that's currently being measured. So on the next slide, we have the cases, and I think the picture is a lot better when we start to look at the things that we care about. Death rate is down, mortality rate, hospitalization rate is down, and these are kind of little again here. But the rate of hospitalization is down. I mentioned the ICU and the ventilators. Number of cases up, but I think that gets us off the mark, especially as we looked at that last data in the last presentation where we're just looking at the cumulative amounts, right? It's like we start in March and wow, it's at 9,000 cases, 14,000 cases, and we just kind of keep that cumulative total going, which I don't think really shows the data in an appropriate way in terms of policy action for you today. So on that graph on the upper part there, you'll see that the mortality rate is, again, there's a color-coded one with the color version. The mortality rate is the one going down significantly, and hospitalization rate. So we have some good things going on with the data in that regard. And also leading us to think that if we're at the capacity rates that we are now with the number of beds available, with that trend line, we shouldn't expect that to all of a sudden spike, and that we're going to maybe be running out of space. So the next part I want to get into is some of these comments that we got from the survey. The one I like here, number 7, was where I had the knowledge problem. So I'm a sole proprietor, I have no employees to instruct or educate, no need for any other measures for safety other than the excessive cleaning and sanitizing I'm already doing. And so the knowledge problem is something that Friedrich Hayek brought up, that the problem with central planning coming down too far is that we don't have the ability to even come close to gathering the information needed. And so I think this comment kind of highlights that if we can use people's individual behavior and individual choices, knowing the risks. And so now that we have more data in, I think people can look at the risks, look at their particular situation, their particular business, and knowing these risks, they are free to choose if they want to shop at that store or if they want to open their business or that sector of their business. Maybe they have a business where there's a retail operation and another operation that's more manufacturing of some sort. Movement to more online, a fraction of their business is online business, a fraction of it is walk-up business. We don't know all those little details on Main Street. We cannot even come close to knowing all that. And that's the type of information that's really needed to efficiently make decisions of whether we should lock down. So the counter to that is to let people figure it out for themselves. If there's an information problem, give both parties to the transaction equal information. So what does that mean? The businesses are selling something, the consumers are buying something. With today's technology, I think the government in many ways falls short with the information that's at our fingertips. 40, 50, 60 years ago, maybe there was more of a need for government to have tighter regulations, tighter restrictions, because there was this information asymmetry between the seller and the buyer. But now with reviews on restaurants and other things, and perhaps you can imagine a time where the government, similar to a food label, there's some sort of disclosure that businesses have to do. So if the alternative was shutting down, a better alternative to me would be to you have to disclose the number of cases or something related, maybe things you're counting in your city, and that has to be published or easily accessible. It'd be super easy for a customer to come up and say, oh, should I go to this pizza place on Main Street or this pizza place? Oh, what's their COVID rating, right? And they just like a review, can choose to go. And if it's a 26-year-old that doesn't have any contact with any vulnerable population, they're like, no, this one's got a better review on COVID, but this one's got better pizza. I'm going to go here, right? People should be free to choose the risk that they want to do, as long as there's not information being held back. That's where we start to run into problems. And the committee has brought up those issues, and we've seen that transpire over time too, in terms of not having a full information set. Okay, so on the property rights, well-defined property rights, we've got business respondent number 6 here. Health experts working at the federal, state, and local levels need to clearly explain how they will determine when to open, when to close businesses, schools, etc. So how do we do that clearly? Again, we have to have those objective benchmarks, variables that aren't at the discretion of a policymaker, but are rather out there and readily available for all people to review. And that's really helping define what a property right is in our state. Business person number 45 here, I worry about the resurgence of infections, which was brought up, because that will cause an entire new group of government restrictions, which will further hurt the economy. So these are all very interconnected. So your question was certainly relevant. If there is threats of new infections coming, maybe we got our eye on the wrong ball to think that we got to watch the number of cases, make sure we're doing that. Again, watch the healthcare capacity variable. As long as those new resurging cases don't demand proportionately more ICU beds or something, keeping our eye on an objective variable will give the public and businesses more clarity as they make these longer-term decisions of what should they do today. A decision that they're making today might impact their business for the next 7 to 10 years, maybe even 15 to 20 if they're looking at expanding something, buying a piece of real estate, adding on land that came up for sale next to them. All these long-run decisions are huge with not having well-defined property rights. And I think policymakers can do a better job of trying to define those, even through this crisis, through identifying variables that are more objective and measurable. So, I got caveat emptor on the last one, buyer beware. Those days are kind of behind us now, apparently. But I think the public, especially Kansans, I might add, are a little more up for a buyer beware situation than others. I think what we see in Kansas are people that are proud of freedom and the ability to choose. And so I think if the governor or other leaders of the state came out and said, listen, this is the way Kansas works. We're going to get all the information about the risk of spread and what's going on. We're going to watch hospital beds, but we're going to stay open. We're going to do everything we can to stay open. If that hospital bed ICU capacity gets up to X% or the mortality rate gets up to X%, again, whatever that X% is determined, then watch out. We might be in a position where even through your best of intentions, you might be spreading the disease, right? But let's hang our hat on our ability to serve people who are sick. And so just part of this comment here from this business owner, let's try to pass some legislation that protects business owners from legal issues resulting from COVID-19. I think the importance there in terms of legislation would be adding more buyer beware provisions, which has been done to some extent, that as long as businesses are following guidelines. But when I read through that, and I didn't read it in detail, I'm not an attorney for one thing, but it looked like there was enough discretion where you end up being before a judge, and you have to say, no, I had disinfectant out, I offered mask up to my employees, you know, and somebody still has a lawsuit, and it's one of those deals, probably going to be easier to just settle out of court rather than fight it. So it got us somewhere, but I don't think it got us all the way there. And I think a stronger caveat emptor type of policy where we just said this is the way Canvas works, would be really beneficial for the long-term health of individuals and businesses. Okay, so then the last page, page 8, in my mind, I wanted to think about the appropriateness of COVID policy as it relates to the idea of federalism, and that we have a limited federal government, and we eventually push more power down to states, more power down to the city and county level. The reason for that is that Americans then can vote with their feet and move from a city that isn't to their preferences to another city or a state from the state. And so there's a lot of logic to a country that values freedom and individuals that value their freedom to have a government set up that way. And so as it relates to COVID, which is very unique, new policy, new frontier, in my mind, I started thinking about, well, what are the things that are appropriate maybe at the governor's level or at the state level versus things that should be pushed down? And using, again, some of the Nobel laureate Hayek's information, that most information is going to be at that local level. And so high-cost decisions, high-cost regulations, whether that be shutdown or something else that's fairly expensive for businesses or for individuals that live in that community, that should be pushed down to a pretty low level of the county or city. And that way, citizens there know each other. They can communicate to their local officials at the county city level and say, no, I don't want to do that, I don't believe that, and they get back to some sort of majority rule at a community level. Makes more sense for those high-cost provisions. So shutdown decisions, other high-cost things, protection and support of vulnerable people. And I think in terms of what's done with the CARES Act money that's going to probably continue to trickle in from the federal government, those decisions be pushed down to those local levels as well, because they're going to know their people better than anybody else. Now, on the state side, or at the countryside, as much as, I don't like to wear these when, it's kind of irritating and all that, it's a fairly low monetary cost. It might come with a lot of aggravation costs, but from a monetary perspective, it's fairly low. So I have a little less issue if there's good data, which I know is big enough. But if there's good data, and it seems to me logically to make sense, that I'm talking and I might have a little something coming out of my mouth and it catches, right? So lower cost changes like that, I have less problems coming in at the state level. And also, I mentioned posting, if businesses within a particular city or something are required to post maybe weekly numbers of the data that's pretty easily available, or somehow there's some communal information, and that's coming from the state to say, hey, just like food labels, how many calories you got in here, what's your percentage of sugar, what's your COVID deal, right? And so requiring stuff like that, again, it's fairly low cost, and I can see that being a better place for the state level government to do. And so, yeah, that's kind of breaking down my concluding thoughts, and we'll open it up for questions. I said individual economic freedom, Kansans are proud of it, and I think we're in a unique position where policy can look different here than it does in other states, and that's okay. I don't think politicians are going to lose votes. In fact, they might gain a few more by embracing some of that. But that's for you guys to decide. That's my. I only lived at Kansas for 10 years, so I'm originally a Minnesotan and then an Iowan, so I have to state that. So in all fairness, keep the decisions local. And increase information sharing. So use the buyer beware concept and be profit. I think Kansans will appreciate that. And then lastly, to target funds to places that are most vulnerable. I personally thought the whole idea of give every citizen money of my federal tax dollars was awful. As an economist, I thought that was awful. You take that money, and I can just imagine, let's spend the same amount of money, but let's put it to vulnerable populations or people who need it most or lower income people or whatever. That's a little side thing. So again, from an economist perspective, always targeting the users or targeting, in this case, those who are harmed is a better general policy than one. Again, it might not be politically feasible, but it still might be worthwhile. So that's it. Question.
Very interesting. One of the one of the things I wish I would have asked the doctor was, at what point did whoever made the decision to shut down or to close schools for the year, at what point was that data, or at what point was the projection that you would do that? So what you're saying then, you know, because that came at very high cost, extremely high cost. And so as we look at some of these suggestions you make about regulations being higher low cost, and then having parameters around what, you know, how we approach those, and targeting those that are most harmed. Because one of the things I hear from my constituency committee, I'm going to open it up here just for a second, but is we've got clusters in nursing homes. We know that those people are vulnerable. So protect those, protect what's going on out west. So I think this has been a nice kind of thought-provoking place to kind of end with things here. But anyway, are there questions? Representative Williams.
Madam Chair, thank you for your testimony. So do you think, you know, we've talked about all kinds of policies that may drive consumer spending, and I'm thinking about, you've got mask policies, you mentioned where you could put a sign on the door. Do you think that right now Kansas is experiencing movement in consumer spending based on different types of policies that may increase fear, reduce fear? For some, maybe wearing a mask reduces fear. For others, it may increase the hassle, and they just decide, I'm not going to go. Because I'm hearing from those in the hospitality that it's not, that once mask policies were implemented in some of those larger cities, that actually their sales dropped. So you can still get out, you can still take your mask off, you can still sit at the table, but maybe there's an encumbrance factor there. Or I'm just wondering if there's any thought on how policy drives consumer spending, especially on these very personal, but very political decisions.
Yeah, I think there is definitely substitution. First of all, I haven't looked at Kansas consumption data in terms of being able to look at that specifically, but I would say Jeff Bezos likes this a lot, Amazon sales, right? So in terms of that substitution of, do I run to my local Walmart, or do I run to, or dial it up on Amazon, I think that's pretty clear with what Amazon stock has been doing lately, that's happening, of course, not only in Kansas, but all over the country. And certainly those are that. So economists call this shoe leather cost. So we added shoe leather costs by putting this mask on. So the gas cost to go to Walmart is still the same. We probably recognize that there's some sort of increased probability that contracting COVID by going to a business rather than staying home. But we make those decisions all the time, right? We can be real safe by banning driving over 20 miles an hour. Like imagine when I go home back to Ottawa here, the speed limit is 20 miles an hour. I mean, we can make things real safe. And so to bring us to those extremes is to raise the point that if we have people know what they're getting into, let's have them be free to choose. And so the knowledge problem and the information of the risk that they're taking on, again, with our individual freedom, I think that's the thing that we can hold dear, that it's not the government's job to protect me. I think it's a good idea to have a rule of law that forces buyers and sellers to have an equal information field when they're engaging in voluntary exchange. And so I think the government can help in that regard. And so there's certainly been consumption that has left the state, dollars that have left the state. People, saving rates, I did look at this number not recently, but within the last month. Saving rates have gone up from, I think it was 7% to 11%. Don't quote me on that, but people are saving their money, not spending, kind of hunkering down. In general, that would be great if that was a long-term trend. I suspect they're just holding back until they're more comfortable to get out and spend that money. But if we, from this pandemic, turned into little savers, which I don't think is going to happen, that what a wonderful thing for society that would be. Because that money, if it's not spent at a store and it's put in a bank or long-term savings, that money is getting out to other productive resources and being invested somewhere in the economy. And that could be a real boon for economic growth long-term.
Thank you, Rick. I was just going to comment that for the states in the U.S. that have the most rigorous and strict regulations, they are seeing the greatest unemployment rate. They're finding the greatest number of individuals moving out of their cities. And so I do think that obviously what we do does impact consumer spending and how people live. And I think fear is also part of that.
Yeah, I might add that this is actually an opportunity for Kansas growth. We all talk about wanting population growth and job growth, and man, if we come out with policies that are more about freedom and something along the lines of what I said, that is where that migration is happening. I have some of that with California moving to Texas, New Yorkers moving to Florida, so that there's really good information on that as it relates to economic freedom, that people are moving to places where there's more freedom.
Representative Clayton.
Thank you, Madam Chair. Thank you for being here today. Thanks for wearing the mask. I like that. So I have a question just sort of to go a little bit more. I think we're going to be talking about this a lot more in our subsequent meetings, too, about how so much of this has to do with consumer confidence. And, I think a lot of us can look and kind of scoff at what government is or isn't doing. But for me, when the pandemic really started to become real, because when I started hearing about it in February, I will fully admit I thought it was a bunch of baloney. But then I started hearing from my friends, in particular ones who work for like larger companies, a telecom company that I won't name, but they started locking down travel, they started locking down conferences, they started having all of their workers working at home. Now, we can control what we do as far as regulation is concerned, but for instance, so Walmart has put in a mask policy, and so is Menards, and I believe Target has too. I can't make them not do that, right? Or I'd rather not regulate private business for doing that. But I think one of the things is what do we do? Because a lot of private businesses have seen this from a socially responsive standpoint. They want to make their consumers feel more safe. But it also backfires and makes other people who might, have concerns about wearing masks or socially distancing, it might make them more inconvenienced. But government doesn't really have a role, or we shouldn't really, in telling private business, hey, you can't regulate because it's scaring people. How do we get beyond the psychology? And again, we'll really be thinking about this. How do we get this beyond the psychology of the consumer to make them less afraid? Because it's not just government that's doing it. When I see a crisis, I look and I see what the people with the money are doing, and it's not us. It's, the people in the private sector. So how do we solve that problem? How would you encourage businesses to help build consumer confidence?
Good question. I think an informed consumer is a less afraid consumer. And so the unknown of not knowing whether they were going to get exposed or not is the thing that creates fear. And so if there's better information through postings or otherwise, even at individual businesses, but certainly at maybe city, county level, I think people are all of a sudden, okay, I know the risk, I can do it. So confidence is going to go up when they're not thinking they're in the hands of the next thing that our directors of health nationwide or in the state of Kansas say that the next thing coming around the corner is this, if we have some of these clear benchmarks in place. I did want to comment, I went to Menards, I had to buy some home improvement stuff, and I thought, this is such a great representation of the free market economy, right? I didn't have a mask. I walk in, there's a big security guard, and I just went in to pick up some supplies, and he says, sorry, you gotta get a mask and buy it for $1 over there, or if you have one, go back out to your truck. But he wouldn't let me in that store. And I heard of other stories where people were like, oh, that's my right to, be able to buy stuff and whatever. Just kind of gets your question of whether you should tell a business that they can't impose masks. The market system is beautiful that way, that they make a business decision that they're going to have masks, and they weighed out the evidence to think that their consumer base would most likely favor masks or not. It could be a personal thing from the owner of the business too, but they make those decisions. And so now, that local knowledge, now I think Menards did nationwide, but you can imagine that other businesses, other chains might push down that decision to the local level, right? And so we're going to require masks at Menards in Kansas, but gosh, in Vermont, there's low to no cases, and we're not going to have the mask requirement. And all of a sudden, without government getting involved, we're harnessing the local knowledge. How do they know that? Well, the managers live there, right? They understand their community and their customers, and so they're going to make that decision without the government making it for them. And so what's going to emerge spontaneously is adjustments to the current conditions, whatever those are. And some businesses more and more will start to maybe increase masks, others won't. The only caveat to that, I would say, is if we don't have good information, and businesses are finding in order to compete, I have to not do a mask, but the rate of transmission or something is so high, or hospital capacity, whatever, then there might be a little bit larger role if the contagion and the risk associated and the consequences of it were so high that we really, the market might not get us the answer that we're looking for. That's a bit of a stretch in my opinion. I almost shouldn't have brought that up, but I think it's so complex that we do have to think about those issues as we look at them on a case-by-case basis.
Very good. Oh, Senator Tyson.
Thank you. Absolutely, thank you for being here. Excellent presentation, and for all of you, my constituents. I couldn't agree with you more. I think this is great data, great information, and you put in the graph of going forward, and I know hindsight's always easier, and I know some decisions were made, like the senator said. We didn't know schools were being closed until we got
calls and emails from parents. The legislature was one of the last groups to know. Yeah.
And the same with the shutdown, until we read it in the papers. So, but hindsight, what is the shutdown? I think the economic fallout,
everything that happened with the shutdown
was much more greater than what we're looking at with the virus.
And we didn't have that data, and I was just the opposite of the representative.
I canceled all of my
pages. I asked my staff to go home before anyone else had done anything, because we did not know what we were facing.
So, like I said, hindsight is easier.
But I would like to know your perspective on the shutdown and the economic impact to Kansas.
So I think I got two responses. One, it kind of ties back to what I said with uncertainty, that in the face of this true uncertainty. So risk is something that we trade all the time, right? So that's why we get insurance policies. They know the probability that we're going to get in a wreck driving from point A to point B. And so risk can be traded. Uncertainty cannot. And so when we have that much uncertainty that we could look at 2 million deaths, just to pick a number out of the air, I think if that uncertainty was true, and it looks like it was, I think it was appropriate to shut down. Now, here's my second part to it. As information came available, though, I think we could have pulled out of it quicker, and I also don't think that the shutdown of the other creating essential, non-essential businesses was the way to go. I think we could have shut down with the stay-at-home order, but all businesses could have been open and doing provisions, whether, I think they're more early on, the mask provision and maybe some other low-cost measures or something, but I think there should have been a distinction between the essential and non-essential, and I think that should have been an individual choice, that once we opened up, we're opened up, and we might have some other laws in place too for general spread, but as that information was coming, we should have been reacting sooner.
Thank you. And that was an excellent comment. I actually had a state representative call me today and say those exact words, that all businesses are essential, and that we need to establish that as a legislature. So,
Thank you, Madam Chair, and thank you for your presentation.
Thank you. One more question. Representative Gartner, and then we'll move on.
Thank you, Madam Chair. What you just said was interesting to me, because we didn't know the unknown, we were uncertain, at that point in time when we shut down. And if masks would have been an option at that point in time, but they weren't, because we were getting conflicting data from the CDC, if I remember correctly. And I think if we would have had good information, I think we could have probably opened back up with masks at that point. But, you know, we didn't have good information.
Yeah.
But, and if I heard you read your information correctly, you think it's viable or a good decision, or a decision that government can make to mandate masks, you know, why this isn't?
I think it's one that I can live with for practical purposes as an economist, because it might be a fairly low-cost measure. So I'm taking it from a pragmatic approach as opposed to whether, you know, how well they can make that decision. So again, if there's a decent amount of uncertainty, the research isn't good, whether masks work or whether masks don't. If it's a fairly low-cost measure anyway, then maybe we go with the benefit of the doubt and do something about that.
Interesting.
Okay, thank you.
Very good. Thank you very much. Appreciate it. We might have you back maybe next session. Thank you. All right, our last item of business is an update on the labor economy and unemployment insurance system with Acting Secretary Ryan Wright. And he is on Zoom. Back row. I know. Maybe at some point we'll improve our technology here at the State House.
Or they can walk across the street.
Or they could walk across the street.
I don't know if you can hear me, but I think Secretary Wright is having issues with his microphone.
Okay, can everybody hear me now?
Yes.
Perfect. Oh, technology. Sorry about that, everybody. Chairwoman Lynn and members of the committee, thank you for having me here today. I appreciate it. Hope to update you on a number of the operations at KDOL, and we'll be happy to answer any questions at the end of this that you have. And I understand that I'm the last person on the agenda today, so I'm hoping I'm not keeping you from getting back on the road and going home. So I've been at the agency for about 6 weeks now, and my role at the agency has really been to assess the operations and implement improvements and generally stabilize the agency until a permanent secretary is appointed. But my top priority is really to get Kansans paid as quickly as possible and improve their customer service experience. I don't need to tell you that this has been a frustrating time. You all are hearing from your constituents all over, and so we're trying to improve that. What I can tell you since I've been here, I've found that the hardworking men and women of the Kansas Department of Labor have actually gone above and beyond to try and assist those Kansans that are out of work and hurting the most. Unfortunately, their best efforts just have not been good enough. The magnitude of this crisis, as in other states, has simply overwhelmed the agency and these existing systems. The situation was exacerbated by the legacy IT systems, which you've heard a lot about, chronic underfunding and leadership failures that have been decades in the making. Of course, none of this matters if you're trying to put food on your table or pay your rent. And as I've said before, and I want to stress again, for those Kansans that continue to struggle because you're waiting on action by my agency, I am sorry. We know that we can and must do better. At Governor Kelly's direction, we've been moving mountains to get additional resources into place so that more Kansans can get paid. We are making headway, but we still have work to do. In addition to getting Kansans paid, one of my other top priorities was to do a deep dive into the systems of the agency and clearly define the problems. I don't believe you can address a problem unless you fully understand the scope of it. And one of the primary challenges at KDOL is that there are so many systems in use, up to 11, that there's no one single point of truth. This has led to confusion, broken promises, and frustration. I, along with the Accenture team and a team of experts from the Department of Administration, Department of Transportation, and the Office of Technology Services, have endeavored to create a single source of truth so that we can begin to make decisions that will ensure Kansans get paid and that we are good stewards of taxpayer dollars. But before I update you on kind of the current system and what's in place, I want to just make sure do a quick look back at where we've been so that we understand fully where we are today. So as I've said, these are unprecedented times across the country. This is going back to 1976 when we first started tracking unemployment data in Kansas on a regular basis. The gold line represents the unemployment rate from January of 76 through June of 2020. The blue bars indicate different times of recession. And this very end section, that is where we're at today. So it's kind of hard to see in this particular slide, but you can start to see the magnitude of the jump of this particular crisis. So in the next slide, you'll see that this is essentially a blow up of that section. So you can see we went from historically low unemployment rate of 2.8% in March to a historic high of 11.9% in April. So, and this happened almost literally overnight. So let's put this in a little bit of context. All of this has led to unprecedented levels of unemployment insurance claims and benefits paid. The blue that you'll see on this chart represents the total amount of regular benefits that were paid from 1980 through today. And then the next piece is what we paid out in regular unemployment benefits in 2009 during the Great Recession. I will tell you, for those of you that have seen the unemployment numbers, they use the Great Recession as kind of the high water mark, but that's no longer the case with today's situation. And then the next piece on this slide, this is what's been paid in regular unemployment benefits during the first 7 months of this year. I do want to make a quick note. We've updated this presentation. Some of you have seen parts of this before. On the slide that you have in your packets, the total number of payments of regular paid says 540. We updated that through August 10th, and that number is now actually 575. It's correct on the slide on your screen, but not in your actual packets that you have in front of you. And then the orange represents the additional federal benefits that were provided during the Great Recession. So similar to the programs I'm going to walk you through here shortly. And then the green is the federal pandemic benefits that have paid out from March through today. So that gives you kind of an understanding of how substantial this is. It's literally, they had to add lines to the charts to measure where we're at today. So in general, where we are today, since March of this year, Department of Labor has paid out more than 2 million weekly claims, totaling $1.77 billion in regular unemployment and the new federal pandemic programs. In 2018 and 2019, to give you some idea, KDOL averaged paying out about $46 million in unemployment over the same 4-month period of time. All told, we've seen a 3,478% increase in the amount of money paid this year from the same time period last year. And again, just to kind of put it in to perspective, in 2018, total claimants paid, amounts paid 141.5 million, and in 19 it was 132.9 million. So a fairly substantial increase. So on the next slide, what this is a representation of are the incoming calls you all have heard us talk a lot about, and you have been the recipient of a number of constituent frustrations. This is why. So this slide shows the record-setting call volumes that occurred since the start of the pandemic. Needless to say, we didn't have the infrastructure to support the onslaught of calls that happened. Part of this is because the U.S. Department of Labor funds states based on a formula that is set on the previous year's unemployment rates. So since Kansas had historically low unemployment rates heading into this, that means we were operating on a small staff within the unemployment division. In fact, when the first wave of unemployment filings hit the agency, we had just a little over 20 customer service representatives working in the call centers. At the peak, at the top, and just the highest date, the call center was receiving 1.6 million attempted calls. And so you can imagine with 1.6 million attempts and 20 people at that time, it's no wonder why so many people were understandably frustrated and angry. I want to, the peak that you'll see toward the right side of your slide, it says questions 11 and 12. I'm going to talk a little bit more about this shortly, but when we added those questions back into the questions that were asked for weekly claims, that caused a lot of confusion among folks. And so that caused, that's responsible for a big part of that spikes. We had to add those questions in. It was required by the feds. They had initially allowed states to relax those. This is the able and available question. Are you able to work? Are you available to work? And so this is the result of that. And we've been working through that ever since. But what you can see from this is the trends are heading in the right direction. We're bringing online new resources and getting folks taken care of. So just to give you kind of an idea of where we're at. So regular unemployment insurance started with 25, as I said. We're now at currently around 128. And we estimate that in order to handle this call volume, we're actually going to need to end up being somewhere closer to 205. Now, that's just the phones. So there's adjudications and appeals, and I'm going to touch on that. And you can see that there are corresponding pieces for each of this. The second part of this is the PUA program. That's on the bottom of this chart. And we will, and I'm going to touch on this also just in a minute, but what I think we need to really understand, and if you all take nothing else away from this presentation, the PUA program is not a normal program. This is setting up an entirely new unemployment system. And so as a result of that, we're going to have to staff up with all of the same mechanisms that are existing in regular unemployment so that we can continue to service those Kansans in need. One of our biggest challenges in keeping, we call them intake on this slide, but those customer service representatives, is that they're one of the lower paid jobs in state government. We start those folks at $14.30 an hour, and the going rate in Topeka for a call center rep is about $16. What this means is we have an attrition rate of near 42%. So it's a very difficult job, and we don't have a problem getting people to apply, but we do have a problem getting people to stay. And so we're trying to work through that. So I know a lot of folks are really wondering, you know, we've heard of this legacy system, you know, what does this look like? So the next slide, this is a good example of what the typical customer service representative has to look at. Each one of these numbers is a different screen that they have to, so every time you have every time somebody calls into the call center, every time a constituent reaches out to you, this same process has to be gone through for every single person. So as I said, they've got to toggle between the mainframe screen and the Siebel screens. And I'm not going to go through a lot of this, but when you hear that we are operating with 1970s technology, if you look at the corner of your screen in slides 3 and 4, that are kind of black screens, those are actually two separate systems, and those are the 70s era technology. And I should say that you can't access those windows with mouses. Like, you have to do hard commands because the technology, a computer mouse didn't exist when they were done. So that's part of that challenge of training folks to take this job, and why it typically takes a customer service rep 6 months to master this. And that's why. So why don't I walk through now the different programs, because there have been a series of them. So the first program that you're going to see, and we'll get into a little bit more specifics here, is the regular unemployment. This is available for folks up to 26 weeks. This is what you think of as the regular unemployment insurance. And this is where folks start. So when they go to the Get Kansas Benefits website, this is where they start. The next program, once they transition from that program, they transition on to the PEUC program, known as the Pandemic Emergency Unemployment Compensation Program. This is a federal extension of benefits. It's a 13-week extension. Then when they complete the PEUC program, they graduate to the Extended Benefit Program. That was just made live, and this provides up to 20 additional weeks for claimants. And then finally, and the program that, again, I mentioned earlier, is the PUA program, and that is available for up to 46 weeks. Now, this is a little bit confusing, or it has been certainly for me. So when folks that are gig workers or self-employed, they don't have the regular unemployment system available to them. So they would come right in at the PUA level. But if you do have regular unemployment insurance available to you, you can still also eventually transition onto PUA, but you do have to go through those other programs first. And then finally, the FPUC, which is the Federal Pandemic Unemployment Compensation Program. This is that $600 you've heard about last weekend. The president issued a memo saying that states could potentially offer up to $400 in this. This is that program that they're talking about. And just to be clear, if you've applied for any of those other programs, UI, PEUC, EB, or PUA, if you fall within the time period that FPUC was live, so that's March 29th through July 25th, those FPUC $600 payments are automatically applied to those benefits. So let me do a little bit deeper dive into each of these programs so you have a better understanding of where we're at. So regular unemployment, the total number of claimants paid to date is 183,213 claimants, and we've paid out a little over $540 million. So there's been some, I think, confusion on this particular slide, and so I want to just provide you a little bit more clarity if I can. So you'll see under the remaining challenges for this program, a claims backlog of 2,320. That's not actually a backlog. We should and will, moving forward, retitle this. That's regular unemployment claims processing. So there's just always an influx of new applications, and that's what this number represents. It's not actually a backlog. It's just the normal processing rate of new claims that come in each week. But where we are backed up is the estimated 25,000 claims that are in the adjudications and appeals process. And let me drill in on this number a little bit deeper. So of that 25,000, 22,456 claimants are waiting to be adjudicated, and 25,000 are in the appeals process, which means they've been found to not be eligible and they're appealing that. That number is actually down from 5,000. So that's a little bit of good news. But out of the claims that are pending adjudications, of roughly 12,000 of those deal with eligibility issues. So I mentioned earlier that we added that question 11 and 12. Are you able and available to work? This is where this is showing up as a backlog and why that spike has occurred. So what a lot of folks have been really confused about this. In normal times, it's not an issue, but in these times when your job maybe has gone away because of COVID, they're not really sure how to answer that. And so what we have seen is as soon as we put those questions into place, people that normally would have answered that because they had answered it in all the previous weeks one way, answered it a different way. And that was around 5,600 folks that are caught in this limbo. And these are the folks that we are looking at doing a mass adjudication approval so that we can get them out of this limbo state and back onto the process for getting payments. I will tell you though, outside of that 5,600, claims are like fingerprints. Every single one of them is unique. So this particular issue is going to take time to clear. One of the biggest things that I did in coming into the agency So in order to handle the influx of calls, a number of existing KDOL staff were tasked over to answering calls, and that included a number of employees in the adjudication section. And so, of course, if they're answering phones, that means they're not dealing with those adjudications and appeals. So as we've brought on Accenture staff and hired additional customer service reps, we've been moving those KDOL staff back to their day jobs so that they can actually get to working on these adjudication and appeals backlogs. So we're trying to get, my goal has been to get the normal parts of the agency functioning again. It was essentially on a suspended animation when I walked in. So, and then one of the big problems, and you all will appreciate this too, is that we have an estimated 10,000 folks that have reached out to the agency through email and through forms that have not been responded to. Part of the challenge is there is no single source, even though they're using 11 different systems, there's no single source for tracking. So if a constituent reaches out to you and you send a letter to us or you send their email to us, they may have also reached out to us. They may have also reached out to the call center. And so what's happened is there's no centralized system to be able to say, okay, Jane or John Doe reached out, this is their issue, and these are the people that they've talked to. Now, if they've actually communicated with the customer service representative, that is logged in the system, but it creates a problem where we're trying to work through this because we don't actually think that there's 10,000 people that haven't been responded to. We think they have been responded to in some form or fashion, a number of them, but we're trying to sort through and get to the real number, and that's just taking a little bit of time. So that is how this shows up, but I wanted to show that for you. And we're also bringing on different tools so that folks have access to the information so that they can gain access to their own information. So the next slide is what the regular unemployment benefits draw from the trust fund. And I know this is of concern to a lot of folks. So we've added some information here in the next couple of slides that will hopefully help to provide some context. We're seeing a steady drawdown of trust fund because of, but because of the legislation that you all passed previously, the good news is Kansas's trust fund started off in a much stronger, healthier place than a lot of other states. In fact, the U.S. Department of Labor uses a metric known as the average high cost multiple, ACHM, which they use to essentially judge the health of a program. And because we had such a healthy program going into this, if and when we need to start drawing federal funds down to replenish the trust fund, if and when it goes insolvent, we expect that this that we will not be charged interest for that because we had those good fiscal policies in place. So that's really good news, and that was something that you all helped put in place years ago after the Great Recession. But one of the things that we should look at is, to put it again in perspective, is that we are just now, there's about 600 million left in the trust fund, and we are just now getting to where the trust fund was at its healthiest point during the Great Recession. So just a good kind of metric for you all to have as a comparison. So we're just now getting to the point where we were in the Great Recession as far as the health of the trust fund. At this point, we'll have to wait and see what happens with the fall, but we, at this point, do not think that the trust fund will go insolvent this year. But let's take a look at some of those projections. So these were just completed, and and yesterday, and we're working on actually a more comprehensive report that is better explains this for legislators, because I know that this is of importance to you all. So the slide you're looking at is an absolute worst case scenario. So this slide takes into account if there is not one more contribution into the trust fund. If that happens and we stay at the current rate of payout, the trust fund is estimated to go insolvent in December. But I want to stress this is absolute worst case scenario, and we will get contributions into the trust fund. So this is not a realistic scenario, but I wanted you to see it. The next slide is probably closer to reality. So this takes into account what employers are paying into the trust fund and what that looks like. And even with that, it appears at this point, again, all things being equal and not knowing what's going to happen in the fall with the COVID disease and the economic impacts of that, we project that we could go insolvent in the trust fund in January of next year. And a couple of variables to consider that are fairly important at this, because this is all still art. We're trying to finesse this to make sure that we have accurate numbers, but there's so many variables right now, it's very difficult to nail down specifics. But despite these projections being based on the highest unemployment rates of the pandemic to date, the rate of payout from the trust fund is dependent on the unemployment picture. So if we do see a spike that is as bad or greater than what we saw in the spring, that will cause a drain on the trust fund quite a bit faster. We won't actually be able to make the final projections on this until we have the complete second quarter benefits that are charged against employers, and those numbers will be coming into us at the end of October, and so we hope to have those numbers finalized by early November, and this will give us an indication of what employers have given to the fund. The other piece of this, though, that I do need to mention is during the special session, the legislature froze the business rates that businesses will fund the trust fund at. The unintended consequence of that is it will ensure that the trust fund runs out of money faster. Understandable that it was passed to help businesses, but just the consequences of that decision are that the trust fund will go insolvent quicker. And so the next slide provides a bit of a better visual for this large chart this previous slide. So the blue line is the current and projected trust fund balance as we spin down the trust fund. The red lines, which are very hard to see, are what those estimated contributions from employers will be. And again, this is where that legislative action is being seen most, because it's frozen those rates at that level. And then the green line represents the current highest month payout in the trust fund. And again, of course, this is subject to change either in a positive or negative direction based on our unemployment situation. So anyway, that was a deep dive into regular unemployment, but I know the trust fund's been on a lot of folks' minds, and we are working on a standalone report that better explains this so that you all have that. And now that we have these projections, we can start assembling that and get that over to you all. The next program is the PEUC program, again, available up to 13 weeks. To date, we've paid out 4,200 people and almost $9 million. This program, there's not a backlog of claimants, but we do are seeing some technical errors in the coding, which are affecting those payments to claimants, both positively and negative, meaning some are getting overpaid, some are getting underpaid. And because of the antiquated nature, it just is taking a lot of time to go through and sort that out and remove that confusion that folks are facing. And then this, of course, the other thing that's really problematic, because this has also come up, is if folks are eligible for applying in other states, this is where some of that shows up. You have to have exhausted your unemployment benefits in both Kansas and the other states you're eligible before you can move on to the PUC program. So for those of you that represent areas of Johnson County or border counties, this is particularly an issue for your folks that may work or have worked in neighboring states. So you've got to exhaust those benefits in both places. The next program, again, is extended benefits. And again, this is open up to 20 weeks. Not a lot of folks are involved in this program yet because it just was brought online and folks are still working their way through those other two programs. And so up to today, the number of claimants served is 268 and just a little over $260,000 has been paid out. I think our biggest challenge in this particular area is letting folks know that as they start to roll off PUC, that extended benefits are ready and that they can be moved and transitioned onto that program. We're actually working on some specific language to be able to communicate to those folks that will help ease that transition so that they're not caught waiting for these benefits to kick in. So we will continue to see the number of folks involved in this grow. And I want to also just mention, I said earlier that regular unemployment is the only current unemployment program that's drawing from the state's trust fund. Extended benefits are being picked up at a rate of 100% right now by the feds, unless you're a government or tribal employer, and then we are paying 100% of those costs. Normally it would be a 50-50 split. So that's where we're at on that particular program. And then this, spending a little bit of time on the FPUC program. Again, this is the program that expired, the $600 a week. So far, 218,483 claimants have been paid for a little over $1.1 billion. Where this number, even though this program is expired, this number will continue to grow, because if you were eligible, if you're stuck right now in the appeals and adjudication process and you're eligible for these funds, then they will be applied to your claims that are in administrative limbo right now automatically. So even though the program is expired, you will still get, those claimants will still get those unemployment benefits. So this will continue to pay out even though it's expired, as long as your claim is valid and was paid out in the allowed time frame, so that March 29th to July 5th. Folks don't need to do anything with this. Again, it's automatically added to it. And I can talk more if you all have questions about President Trump's questions, or not questions, but his executive memo and how that might impact this later. For the PUA program, again, available for up to 46 weeks. Total number of claimants paid out to date is 25,000, almost 26,000, and 97 million. This remains our biggest challenge. This program is not yet built out. But as I said earlier, it's really important to understand that PUA is not just an extension of a federal program like the ones I've just talked about. It is an entirely new and different program than the traditional unemployment. In fact, it hasn't been since regular unemployment was implemented in 1935 that each state had to create a program like this. But that's what we're having to do. So we're having to scramble, put together that infrastructure, both intake for accepting those and then adjudicating those along the way, and making sure that people can appeal and that they're heard. The other thing to note is this is a whole new universe of people that have not been traditionally eligible in the past. And the regular unemployment system is built on a relationship between employers and employees. And that just doesn't exist in the PUA program because there aren't usually employers because they're self-employed. This, of course, increases the risk of fraud. And we haven't seen it as bad in Kansas as they have in other states, but we are seeing it. And we've been putting in place a number of factors to help mitigate that. But in just the first 2 weeks of July, we estimate that over 35% of the new claims that we received were fraudulent. And to put this in perspective, it only takes 44 PUA claims paying at the maximum amount to equal $1 million. So there's been significant backlog due to the processing and program issues, limited claimants being paid. We know that we have at least 20,000 people that have applied that need to go through the adjudications process. Some of those are eligible, some of them are not, but we have to go through and adjudicate each of those folks. And then we're working on communicating with folks directly. One of the challenges that we found in coming into this job is that the agency was doing a lot of broad communications, which were well-intentioned, but because there are so many new programs that were implemented, it was causing confusion among the public. And so we are communicating out the broad pieces that impact everybody, but instead of broadcasting everything to everybody, we are targeting those communications to those people that are impacted. So if you're a PUA person, you will just be receiving the PUA information that pertains to you. You won't be receiving the information on the other 4 programs. But as I said, we're seeing a large increase in identity theft. You all have heard a lot about this. I want to be clear, KDOL systems have not been compromised. This is regular run-of-the-mill identity theft that is happening, unfortunately. They're getting this through other data breaches and piecing things together. They're hitting businesses, so we're seeing multiple employees of the same business being hit. And so that is happening. There is also a more sophisticated level of fraud that's occurring, but the one that most people are hearing a lot about right now is identity theft. We've implemented a number of procedures to assist staff in vetting all of those new claims that are put in. So there's a 72-hour window for new claimants only. So that allows us to do some background checks and work with our national partners to make sure that it's not somebody that's applied in this state, but it's also applied in Missouri and Ohio and Florida with the same information. And again, this is possible because this is a new program and none of the states have it fully built out yet. And so it's just one of those challenges we're working through. And then finally, one of the things that we just launched was a reportfraud.ks.gov website, reportfraud.ks.gov. This will allow Kansans who think that they have been the victim of identity theft to go onto that website and put their information in. And so what's happened in the past is somebody would send an email into the system. A KDOL staffer from the fraud team would reach out to them, and it would end up being a 2 and 3 and 4 email exchanges just to get the right information. That's not efficient. And so, and it frustrates those claimants that are trying to get their personal information protected. And so we put in place this system so people fill out all the required fields that we need. And then on the back end, it essentially automates it for as much as can be. It still requires a human touch, but we can then go in and suspend those accounts en masse so that we cut down on this back and forth. So if somebody thinks they've been a victim of identity theft, they fill out the form, it gets suspended. And the piece that is helpful for constituents is that it also automatically generates an email to them with a police report that they can then take to their banks and creditors, and also a list of helpful tips on what they need to do to next steps to protect their identity. So this is a really important new tool that we have, and we are in the process of amplifying this and making sure folks know about it, including businesses. In the coming weeks, we will be reaching out directly with businesses across the state to make sure they know about this, because a number of businesses have been hit. And so we want to make sure that they're hearing about this. And unfortunately, most people don't know they're the victims of identity theft until they get a note from us saying that they are qualified for benefits, and then they realize that they still have jobs. So that's not good. But anyway, this is a really positive step. But this is exactly when I talked earlier about this 10,000 backlog in emails. This is what we're trying to put in place, more automated systems so that folks aren't waiting on a KDOL staffer to get back. We want to get that information that we need on the front end so that we can take care of them immediately and cut down on this back and forth. So as we move forward, look for additional changes in this space to help make that more efficient so that we can get folks responded to quickly with information that's actually helpful to them. And then I know a lot of you have been wondering, what have we been doing since we have had Accenture on board? So first and foremost, as I mentioned, we brought them in to help us with the call center management and providing surge support. So we have initially contracted with them for 50 customer service representatives to augment the KDOL ones. This has allowed us to move those KDOL employees that had been repurposed over back to their day jobs so that they can get things moving again. So this is really good. We're in talks with them now and looking at increasing that to meet that demand. We want to make sure we have people in place so that if, God forbid, we see a spike in unemployment like we did in the spring, that we have folks ready to go to help Kansans that are in desperate need of help. And then on the information technology side, we asked them to come in and look at and do a briefing on or do a deep dive into our technology systems and find out what we need to do right now to stabilize our existing system. And I've asked them to tease out not just what we need to do to stabilize the existing system, but then what of their findings is really truly part of the modernization process, which we're going to have that conversation in the near future. I will tell you, these are very raw numbers and we don't have any proposals. We just have back of the envelope math right now, but we think could take between $8 and $10 million to stabilize the existing IT system that supports the unemployment system. And so we'll be we're waiting on the final report from Accenture from their initial review. I hope that we will have that. Frankly, I'd hope we'd had it the time I testified here today. That didn't happen, but we expect it soon. And then there'll be a separate modernization piece that is totally separate from this, and that is estimated to be somewhere between 40 and 50 million. And then I mentioned that communications review. It's really a customer service review. I mentioned how we're talking to folks more one-on-one based on their particular problem, and not just taking a shotgun approach and hitting them with everything in the kitchen sink, which just confuses them. So look for a lot more of that directed communication so that folks have it. I want to be clear, this is not crisis communications. That's not what this is. This is looking at operationally what we need to do to make sure that we're conveying the right information to claimants. So that's what this is. We're also looking to redesign the websites so that we can make that a better user experience. And then we have since expanded the scope of this. We've spent almost coming on $2 billion. It just makes sense that we have an audit done to find out where we're at on the accounting side and make sure that everything is on the up and up, which we have no reason to suspect that it's not. But when you're dealing with this number of payouts and these size of dollar figures, it just makes sense that we do it, and we're going to have to do it anyway. The U.S. Department of Labor does audits, and I think Legislative Post Audit is also looking at some different components that may overlap on this. So we're being proactive, and we're starting this process now. We've also asked Accenture to do a database health check to find out exactly where those parts of the database, and this is a very technical piece, which I can't really go into great detail about, but we can, if you're interested in more information, I can get it for you. But it's basically where are the broken pieces within the database and how do we fix those to streamline and optimize performance. And then finally, I mentioned PUA operational assessment. So to be candid with you, as you all know from your conversations with your constituents, this program is not built out, but it's not a simple build out. It is an entirely new, essentially, division. And so we're learning from what other states are doing and putting those best practices into place so that we make sure that we're not missing things and that we're being, again, good stewards of taxpayer dollars. So where are we at to date? We've hired 50 additional call center agents. This was that Accenture contract, that surge. We continue to have KDOL customer service representatives in the regular jobs. This was a huge deal. And we will continue to increase capacity in this. We just recently revamped the call queue system to accommodate more callers. To date, when that went live last Monday, a week ago Monday, and in the first day we saw a drop in 100,000 calls, and we saw more than a 50%, I think the number is escaping me right now, drop in angry calls, like which are people that call, hang up, call, hang up, call, hang up. They're not angry, they become angry because they can't get a person. And so anyway, that tells us that this new call system is working, and we've had a lot of good feedback from folks. We're getting people through those systems to the right people quicker and more efficient, and we will continue to build on that. We also launched the Amelia online assistant. This says today over 170,000 messages have been exchanged. That's an old number. It's actually 305,000 messages that have been exchanged with folks. And this has just been online for a couple of weeks. And so we're looking at anything that we can do to reduce stress. So this is a perfect example of if you get up in the middle of the night and you want to find out information, you can go to this chat bot and ask some of those questions when our call centers are closed and get some of those answers. I will tell you the next phase of this, which we're pretty excited about, is after you get through this chat bot, if you still don't have what you need or if your issue is more complicated, we're putting in place a connector that will then transfer you to a live operator. And we did a soft rollout of this last week, and so far to date, we've had just right at 1,000 people have taken advantage of that. So this is really good news. These are another great example of how we're getting additional resources into this space with the sole goal of increasing the customer service experience for callers. And then again, we've hired additional IT programming and analyst staff. This is no easy feat. The language that our system was built in, Cobalt VSAM, is not a language that's taught anymore. And so we literally scoured hundreds of IT placement folks and got less across the country and got less than a dozen resumes back. We're actually pulling people out of retirement because they're the ones that understand the language to help us. This is not your normal IT issue where you can just go hire a recent grad off the street, unfortunately. It's just one of the technical pieces of this. We've implemented the extended benefit program. We've implemented a number of identity fraud mitigation and identification steps that I talked about. And like I said, we're very close to finalizing the Accenture assessment. And I know you all are excited or waiting to see that. So as are we. So we're wanting to make sure we get that available and get it over to you. So what are our priorities going forward? The immediate priorities, and immediate is defined as those priorities that are already in process. We're already working on it. So again, getting more claimants paid, fully implementing the PUA program, stabilizing the IT system, not modernization, this is stabilization. Continuing to work on our fraud mitigation skills, increasing that call center capacity, getting and completing that trust fund analysis so the legislators have the most up-to-date information so they can make additional decisions, completing that audit of the program, making sure that everything's accounted for, and then working on a new customer service program so that claimants get a timely response from the agency. This is the automated piece that I mentioned earlier. What happens next? So we have to improve the IT testing environment. One of the big frustrations is there's no, and I'm not an IT person, so accept my apologies. But basically they've been beta testing in real time because they've been in such a hurry to get people paid that they haven't had time to do the regular testing. So we're creating a testing environment so that testing can be done essentially offline. The bugs can be worked out and then it can be made live. This will cut down on frustration. This will cut down on errors that occur. And so this will be a huge, it doesn't sound like it's a big deal, maybe unless some of you sit on the technology committee, but this is actually a pretty significant piece. Develop a data strategy for moving forward. How are we handling this data in the most efficient way? Again, redesign the website, improve that customer service experience, and then also provide additional self-service tools for claimants. So one of the things we're trying to put in place or looking at putting in place, frankly, is providing statements to folks about where they're at in the process. This doesn't happen now. And so, you know, people, it's no wonder why people have questions. They don't know where they're at in the process. So anything that we can do to help ease the stress on claimants, that's absolutely what we're doing. And then the long term, and so the near term, by the way, is defined as that's going to have to happen in the next weeks to months. That can't wait. And then long term is system modernization. We are in the process of working on an analysis that will present to the Joint Information Technology Committee on what the needs are for modernization so that we can move away from this antiquated system that we have and finally put in place a system that addresses the modern needs of the state. So that was a whole lot of stuff to throw at you all, and I will stop talking now and let you all ask questions and answer whatever you've got.
Thank you. That was a lot, and I know it's getting late, and you know, I'm sure we're going to have more questions about this as well as we move forward with these discussions. There are questions from the committee now, and I have some questions as well. I just want to, first of all, I just want to thank you for doing this. And I know all of us have been inundated, and I will say Laurel and Brett and Julie have been amazing, providing communications back to us, pushing things through. That's really important. And so I know you guys are working hard, is all that to say. So I'm going to open it up to Senator Hildebrand. He has some questions. Is he there?
Should be just unmuted.
Okay. Can you hear us, Senator? Whoops, your volume is not on. Can you hear us?
According to our stuff, he is not. So
look at your volume.
We might need to circle back around to, you could circle back around if anybody.
Okay. Let's go ahead and, are there any other questions from the committee? Senator Tall, or Representative Talawada.
Thank you very much. Okay, Mr. Secretary, thanks for all your hard work and thanks for taking this thankless job. We clearly got a lot to do there, and I had a couple of questions for you regarding. Let's start with the Accenture deal. You said it's going to take, or you've invested $2 million with them already, I believe, and you expect to spend $8 to $9 more million in stabilization, but then we're going to look at modernization as well. Can you tell me first what is the anticipated price tag for the modernization program?
Yes, thanks, Representative. So we will know more when the study is complete that we have to present to JCIT, but the very, very rough numbers that we've been given are somewhere between 40 and 50 million. Now that won't all come in one tranche, and I will say we keep hearing rumors that in this next stimulus package, if Congress is able to reach an agreement, that there will be money from the feds specifically earmarked for at least starting that modernization process. I will say Brett Flashbarth, the Deputy Secretary, is on this call, and he has been very involved in the modernization process, so he may be able to speak in a little bit more detail to your question. But before we turn over to him, I want to be real clear. This money isn't going to Accenture. So I don't even think Accenture is operating in the modernization space right now. And that number, while they've made the identification of those stabilization systems or things that need to be stabilized, we are looking at, as we find out what those are, we're looking at other vendors to implement that. This is not a sole, everything goes to Accenture process. So
Accenture is in charge of the stabilization, but not the modernization.
No, Accenture's in charge of the identification of the problems. And then once they have those problems identified, then we're going to figure out, do we have existing entities on retainer with the state that we can go to? Do we need to bid that out? What does that need to look like? What is critical? Like, what do we need to do tomorrow to make sure the system doesn't crash versus what can be done, 4 or 6 months from now, which would allow for a more traditional bidding process. But for example, so one of the things that Accenture came back to us, they wanted to know, they needed data and analytics, and we said no, we're not going to go with Accenture for that. There was an existing, there's a vendor that did work for the department a few years ago, and so we reached back out to that vendor because they were still on contract with the agency, and so we're working through that vendor. But that's one example of how they identified a problem, and we decided to go in a different direction. So I don't know, candidly, as I'm sitting here today, to tell you if any part of that will go to Accenture on the stabilization front, but we're certainly not looking to them to be the sole voice.
So on the original contract with Accenture, was that bid out or was that a no bid contract?
So the assessment phase, which was is 388,000, that was handled under an existing master contract with the state. The subsequent work, so about $1 million so far. I'm sorry, that's not true. About 500,000, $1.5 million has been handled so far through a no bid contract handled under the emergency procurement laws with ks.gov directly. But the initial assessment piece was not. That was handled under an existing master contract with the state.
Yeah, one more question.
Okay, go ahead.
I'm looking at the, let's see, I think it's page, well, the trust fund page that you put together for it. The maximum payout, or highest month payout of $139 million, that including federal funds, or is that just the state fund portion?
This is just the state fund portion of it.
Okay. Clearly, we've got to get people back to work.
Yeah.
And allowing us to open over a year of unemployment is going to make it rather difficult. And I've talked to several businesses as the chairman of Commerce in the House side. There are a lot of jobs available, but nobody will take them because they're making a lot of money on unemployment. Almost to the T, that is what these businesses are told. I can't take that job. I'm not sure if they're going to be back in school, and I'm making more than that now, not doing anything. So now, granted, that some of that went away at the end of July, but it looks like President Trump is bringing a portion of that back. But what have you looked at a way to match employees and employers up? When you get the profile on all these people on unemployment. And if we could somehow cross-reference that with the jobs available and have these individuals go interview, and if they don't take the job, they no longer qualify for unemployment. Have you looked at anything like that?
So on the first part of your question, it's my understanding the Department of Commerce has a really good website that they've set up specifically identified as kind of COVID created jobs in addition to other jobs to connect folks with employment. So they do all of that workforce development piece. To the second part or the latter part of your question, that would require legislation. And that would be, we haven't gotten that far yet.
So the current employer offers an old employee that they laid off, if they offer their job back and they don't take it, they still qualify for unemployment.
Laurel is on this line and our unemployment director, and I'd like for her to answer that so I don't say something incorrectly.
Thank you, Secretary Wright. Current Kansas law provides that if a claimant refuses an offer of suitable work without good cause, that they will be disqualified for unemployment insurance benefits. So we do have that on the books already. We do have to look at a number of different factors. First of all, is it a suitable job offer? And then secondly, was there good cause if that offer was refused? Very fact specific, but certainly in the scenario that you indicated, Representative, I believe that there should be a disqualification. And we have tried to streamline our process for reporting job refusals, because we did see that as an issue fairly early in the pandemic, as you talked about the $600, leading to a number of claimants who are saying, I'm actually making more money on unemployment right now. I don't necessarily want to go back to work. And so there is a link on our employer website where employers can go there, click, fill out that job refusal statement. Additionally, the claimants are required to report to us on their weekly claims if they've refused an offer of work, or if they've refused an offer of work. However, we know not everyone is honest, so we want a mechanism in place that the employers have that opportunity to report job refusals to us.
Okay, thank you. And my final question is, you referenced the matching that President Trump signed into Executive Order 14. I guess it's $400 a week that the federal will kick in as long as the state pay up to 25% of that $100. Have you looked at how that's going to be implemented, when that's going to be implemented, and what it's going to cost? Or is that something you're going to opt out of and not offer, or is that going to take legislation to trigger? Thank you.
Great question. Last question first. We've been told that it will not require legislation, at least at this point. I will tell you we're getting federal guidance in a couple of times a day, frankly. So this is changing, but as of right now, it will not require any additional legislation to implement. The feds have said that this can happen one of two ways. We can do $400, which would be $300 from FEMA, Homeland Security, until that money is gone. And then we would match that by $100, and that we could use CARES Act money to match those funds. The other piece that they've just said, which we are doing more digging in on, is that we could basically count $100, the 100 of the 400 toward their weekly claim, and then just use the $300 from the feds. So the truth is, we're still trying to sort through that. There was a call with the White House yesterday, late afternoon, where we got a handful of information. We've been told that we are going to get more detailed guidance from FEMA within the next 48 to 72 hours. So as soon as we have that, we'll know. There's a couple of challenges here, just to be real candid with you in implementing this. If we're a couple weeks away from Congress actually finding a permanent solution to this, it may make more sense to wait and implement that, because the same people that have to implement this temporary change will be the same people that have to implement the permanent change. And all of that requires extensive time within the mainframe to develop. The other piece of this is, we don't have an answer yet from the feds on it, but it's kind of the way they've approached this is it's a first come, first serve on the money, and we'll use it until it's gone. The challenge is, as I mentioned earlier with the FPUC program, there are people in that adjudications window, and once their claim is adjudicated, they will still get paid that $600 because that's owed to them. The feds cover that, they'll get it. But the question that I have is, if we move forward with this, what happens if there are people in an backlogged in an adjudication and we've run out of money? Who's on the hook for that? Are the feds on the hook for that, or are the states on the hook for that? What is our liability there? So we've got to look through that. And then the final piece I'll say on this is, FPUC, in the 4 months that it was operating, we spent over $1 billion on it. So even though the number has been reduced under the president's proposal, there will be a massive draw on funds, and I don't know that we, frankly, candidly, can afford to do it if the feds aren't going to pick up more of that tab. So we're looking at all that. Nothing's been ruled in or out at this point. We're still in the fact-finding mode, but we've got to get some of those questions answered so that we don't end up accidentally putting the state on the hook for millions of dollars that frankly we don't have. So we're looking at it, and I'm hoping that we can figure something out, to be honest with you, because people are still hurting, but there's still just a lot that's left unknown at this point. I will say, sorry, one other piece on this. I know that there's been talk, at least on the Senate side, about there's a lot of interest in putting any leftover CARES Act money into the trust fund to stabilize that. The feds have said you can do that. If we implement this now, we won't be able to do that later. So.
Thank you, Mr. Secretary. Again, I admire you for taking this job. It's a lot, it's a long haul, but I for one look forward to working with you through all these issues in the upcoming year. Thank you very much, and thank you, Madam Chair.
Thank you. Are there any other questions, or Senator Tyson?
Thank you, Madam Chair, and thank you, Mr. Secretary. I tell you, I had a ray of hope after hearing you guys and your IT personnel earlier this week. I would suggest, and this used to be the case, that if federal money was used to develop a software system, that system is available to other states and entities with no charge. There would be a charge, obviously, to implement it and the hardware, software, all that type of stuff that goes with it. But it's something that we could look at, find our best case practices, find a state that we could, one or two states. I would suggest forming a tiger team and to get somebody looking at that as soon as possible. I don't mean to overstep into your business or tell you how to do your job. It's just a suggestion from somebody that's in IT and been in the firing before and understand that time is of the essence. And if somebody can be doing a breakdown, do a matrix to decide whether custom development, try to get a product that exists elsewhere, whatever our best results for the state of Kansas are. Thank you. Thank you, Madam Secretary. Sorry, I just remembered.
I don't think I want that job.
Senator, sorry, if I'm hearing, I want to make sure I'm hearing you right. You're saying work with other states to make sure that we're implementing systems and using efficiencies. Did I get the gist of that right?
Actually,
Senator Tyson.
Thank you, Madam Chair. If I may, to form a tiger team within Kansas to start putting together a plan to look at other states' applications, what's available, so that we can hit the ground running with this thing instead of sitting back and looking.
Yeah, it's a great suggestion, and it's so great that we are starting that process. I think you have mentioned this before, and so you are spot on. And I think we are working with that to figure that out, because every state, or almost every state, with the exception of maybe a half dozen, maybe even less than that, are in the same boat. And so this is a real opportunity to get more eyes on the problem and to take care of that. So great suggestion. I will make sure that our team follows up with you and keeps you up to speed on that.
Thank you, Mr. Secretary, and I thought it fell on deaf ears, so I'm glad it didn't. And I appreciate a follow-up. I think all the committee members would appreciate that, so thank you.
And Ryan, he disappeared.
Yep. Yes.
Okay.
Senator.
You obviously belong to some sort of an association for the executives that do your kind of work. And so you are aware then that there are other states that are experiencing this. So, in a way, that makes us all feel a little better. Not that other states are experiencing it, but, you know, I've been on post audit and a long time, and IT is just something that is just constantly changing, and, you know, it is rather, I mean, it's just too bad that we have been so behind in all of that, and it's understandable. I guess, are you getting information and help and support from your association? Are they able to hook you up with people that can help?
Absolutely. Our national group is called NASWA, Brett, I've been on a handful of calls with them already over just this, as has our team, and not just the leadership of our team, but we're doing a deep dive so that we're getting these folks connected. But Brett, can you speak to this a little bit for the senator? Because you've really been spearheading this effort.
Yeah, that's an excellent question, and it piggybacks also on the great question from Senator Tyson. So we engage with NASWA on many fronts. We've been engaged with their integrity staff to assist us trying to figure out best practices that states are using to combat the identity theft fraud that's taking place all over the country. We also engage with a subset of NASWA solely devoted to modernization. Best practices, what has worked in other states, what are the emerging trends, what has gone well on state IT projects, what has gone poorly. As we were working towards modernization in the last year, we actually had, much like the senator's suggestion, that was traveling last fall, that included myself, our IT director, employment director, looking at the states that have successfully modernized and trying to there's a feasible path for Kansas to try and follow to modernize as quickly and successfully as possible. So in addition to that, there's almost weekly calls from NASWA that take place, helping distill down when new action comes down from the federal government, the president's orders, answering questions that will help the states try and implement as quickly as possible. So we're engaged on using the NASWA resources on many different levels, including on prevention and modernization.
And they've been very, very helpful. And I'm happy to talk to you more about this offline and not in open session, but they've been very helpful on the fraud side. They've actually spearheaded a national effort to help connect states to help reduce that fraud piece. And I'm happy to have detailed conversations with you offline on that.
Well, thank you. You know, anytime there's a big pot of money out there, those people do somehow figure out how to work the system. So it's unfortunate, but I'm glad you're on top of it. So any other questions from the committee? Thank you so much. Oh,
Senator Hildebrand might be.
Excuse me.
Senator Hildebrand. Might
try to get. Senator Hildebrand has appeared. So can you hold for that?
Absolutely.
Senator?
It's not every day I take a question from Roseanne's living room.
Thank you.
I love it.
Yeah, I do too. Oh, there you go. What if he has an internet problem?
He did type the question. I can read.
Okay, go ahead.
All right.
Can you hear me now?
Okay, we can hear you now.
Yes.
Are you able to hear me?
Yes.
Yes.
Okay. Thank you for your time and patience with my internet problems. But my question for you, Mr. Acting Secretary, is the PUA program. You had mentioned there were like 20,000 that have not been paid under that program yet. Is that correct?
That is correct. They have applied. We've paid out 26,000, just under 26,000, and we have 20,000 that are in that adjudication process. The reason for that high number is there's literally not an adjudications division. So we're having to build that out. That's a perfect example of how it exists under the regular UI system, but it doesn't exist under this. So like under the regular UI system, we have access to those financial records because of the way the employer-employee system works, but here it's the opposite. So you have to basically provide proof. So it has been a problem. We are hoping that Accenture, after they do their review of that piece, that will not be in this first round of report because we added that on later, but will help us build that out as quickly as possible and as efficiently as possible.
Okay, because there's a lot of frustration with that program because Kansans have gone since March without receiving anything. And when they ask, and even when I ask, send an email, I am told that they will the Department of Labor will let us know when it's ready to go instead of giving us a time frame. Can you give us a time frame so we have something better to know, so our constituents have an idea of when they can expect it instead of you'll get it when you get it?
I can't. And more to the point, I don't want to give you something that's wrong. This is my getting a single source of information. One of the frustrations that I've had is that labor has said one thing and then it ends up not being accurate. They believed it when they said it, but it ended up not being true. So I don't want to get people's hopes up. What I will commit to you to do is to follow back up with you on this and talk to our team and see where we're at with. Just to be very honest and candid with you, this is something that I don't think internally, because they were trying to implement these other programs, that they appreciated the scope of what PUA really was, and that it was a whole new system. And so up until this point, the PUA program has been understaffed and under-resourced, and the decision was made to build this out internally instead of hire it out. And there were reasons for that, very good reasons, because you have to make it work with the existing system. But what I commit to you, sir, is to get you a better answer. But I want to talk to our team and not give you something right now that is definitely wrong. But please know that the PUA program is now our #1 priority in getting this sorted out and fixed. So, I know people are really frustrated. It's unacceptable, and I get it.
Yeah, and listening and hearing some of the stories of people losing their homes and their cars, and it's heartbreaking. So that's very much appreciated. The other question I had, you had mentioned something about the PUC program, that there have been underpayments as well as overpayments. My question is, because no problems with the PUA program was some of these people had been listed as fraudulent because they had received an overpayment sometime before, so they didn't qualify for the regular unemployment benefit, so they had to go to the PUA program. Well, is this going to cause the same issue where they're on a 5-year freeze out where they cannot get unemployment benefits anymore because they had received a overpayment in the PUC program and they weren't aware of it? Can you answer that?
Let me tell you this, if the error was on our part, that won't be used against them. But let me have Brett answer that in more detail, because he's an attorney and can give you the legal piece.
I'm a recovering attorney. So that's an excellent question. So historically, if anyone had a fraud disqualification under state law, they would not be able to get unemployment benefits for that period of disqualification according to state law. And that included federal programs. Here in Kansas, we do have an extremely long fraud disqualification period, years. That was passed as part of House Bill 2105 in 2013. So that 5-year period is one of the longest defined benefit denial periods for fraud in the country. If PUA was a little bit different, trying to get clear guidance from the federal government early on in for several weeks. Finally, we're able to receive guidance that said, if you get fraud disqualification, you can get pandemic unemployment assistance, even if you're still disqualified under state law. The challenge on that is that had never existed in unemployment insurance before. So as part of that challenge of bringing all the potential eligible claimants under PUA, and having to try and figure out how we account for these qualified for fraud. There's no, as the secretary pointed out, just getting benefits you shouldn't have got does not mean that you committed fraud. There has to be a finding that you knowingly committed unemployment fraud and attempted to get benefits to which you were not entitled. And there's a determination that's issued, and everyone who receives that fraud determination is entitled to a due process, appeal process where they can dispute those findings. We did also attempt this year legislatively to try and make it so that individuals who had paid back any fraud benefits would then be able to receive unemployment benefits again if they pay back all penalty and interest. And unfortunately, we weren't able to get any forward traction on that. So I hope that answers your question. But to the Secretary's point, no one who made a good faith error is going to be denied. And we are working through the process of trying to figure out how people who have fraud findings can take advantage of pandemic unemployment assistance, which is really a first in the history of the unemployment program of people who have fraud denials being able to receive unemployment.
Okay, thank you very much. I appreciate your time and your answers. Thank you.
Any other questions? I know we probably need to adjourn, but I think they will. Yeah, I think it's important enough, obviously, that we're going to need an update. So, Ryan, thank you very much. Maybe the next time we're together, you can be here in person.
Absolutely. And thank you all. I know it's been extremely frustrating, and I know that the stories coming from constituents are heart-wrenching, and all I can do is take responsibility for what's happened and be as honest and transparent as possible moving forward. And that includes doing a better job from our agency of communicating with you all, not just when you have constituent concerns, but when you have when you just need to know what's happening in the agency. So just know that my phone is always on, and if you all have questions after this, please feel free to reach out. I'm happy to come back and talk to the committee anytime. And I really appreciate you all taking just an honest and earnest approach to this, and giving us some grace as we try and handle what is an unprecedented time. And we will do better.
I believe you will. For the committee, would you mind just sending us your contact information? I know when you were announced, it probably came out, but it might be good just for this committee to get a refresher on that. And if you feel comfortable, maybe not. If you have a cell phone, you can share with committee only, since we're going to be working together here in the next few months. And if you're not, I get that. So
no.
Anyway.
We'll get it to you.
Thank you. That's very kind of you. So committee, wow, what a day. And we have another one tomorrow. So everybody needs to go home and get some sleep tonight and wake up refreshed. So tomorrow we're going to start with the chamber. You've got your agenda in front of you, but it's another full day. So thank you so much, committee. Thank you for your work and your attendance. We're adjourned.